afternoon, ladies and gentlemen. Am I audible? Yes, great. So thank you for being a very patient audience. As usual, we are going by the Indian Standard Time and by the Pune Standard Time. So thank you so much for your patience. We'll be starting the event now. So first of all, welcome to all of you. I have to say this right at the beginning that an event such as this one would not have been possible without a diverse and a really engaging audience such as yourself. So I welcome you all here. I'm Varun Khandare. I'm the founding director of the Strategic Research and Growth Foundation. We're a Pune-based non-profit organization that primarily works in the areas of social impact, capacity building, and policy recommendations with an emphasis on sustainable growth and development for the society. I must say that we are a relatively new organization, a very young one in fact, and we only started off our operations very recently. So I'm quite elated and happy to be able to host an event such as this one for the city of Pune that I truly love. So it goes without saying that I have to thank the Ministry of Youth and Sports, our co-hosts for this event, the Research and Information System for Developing Countries, New Delhi, RIS, and the Progressive Education Society, which is one of Pune's earliest institutions of its kind. So my note of thanks to them. Now, I'll quickly tell you a little bit about my organization, that is SRGF. The way we have started operations this year, the idea is, like I said, to bring about sustainable growth and development for the society. And that's why we've picked out the areas that I told you about. Capacity building, looking at how we can prepare our people for the future. Social impact, something that is truly the need of the hour. And of course, none of these things ever become possible without actionable policy inputs, which have first been tested, at least by moving them from a concept to a proof of concept stage, and then taking them to the policy level. So that is what today's event is all about. We are looking at the broader theme of health as a larger perspective for the youth. But our sub-theme is to do with promoting digital health infrastructure. Now, one of the reasons why we picked out this specific sub-theme is because it fits in very well with the fabric of this city. We are known all over as an IT hub. I think we were one of the original IT hubs that kicked off in the country. So, of course, that and healthcare put together, and looking at the scope of the youth of the city, there couldn't have been a better theme for us to go with. So, this is the reason that we've picked this theme, and that's why we are now looking at having a discourse on this topic today, where we have Dr. Chaitanya Giri, who is going to be chairing the session, and an equally eminent panel of participants. So, of course, I would leave that for later when you get introduced to the panel. For now, the idea is that once the session kicks off and you have heard out the points and the discussions as they go on, I very sincerely request all of you to pay attention to what is being discussed. And I would really be happy if you could participate towards the end of the session by way of a Q&A, because that is what makes this whole concept work. What we are doing here is almost on the lines of something like a town hall. So participation from your end is highly sought after, and it is welcome as well. So I would definitely request all of you to follow along and to come up with relevant questions or even recommendations for that matter. It doesn't only have to be questions from your end. If you feel that there is something worth mentioning something worth contributing to, please do so. Now, one of the things that I have to tell you is that once we conclude this event today, we are going to be forming the key insights and takeaways into a report, which is going to be submitted to the Y20 Secretariat in New Delhi. And hopefully, we are at least aiming to have some of our policy inputs reach Y20 for them to consider it positively, and then to add them to the report that they are forming once they host the G20 summit in September in New Delhi. So our aim is to take some kind of an actionable insight from here, from our city, from our people, and try and get it into that report and see how that could then be taken up further. So now, without taking up any more time, I would like to invite Mr. Ali Syed, who's representing RIS from New Delhi. He's going to say a few words before we kick off the session. Ms. Nivedita Ekbote of PES is also going to be with us. She's on her way. She'll be here shortly. Ali?
Welcome to all of you. Thank you, Varun, for helping us put this session together. The idea of G20 right from the beginning was to make it as inclusive as possible across all sections, across all facets. And as part of that inclusive nature of the G20 proceedings, we've been conducting sessions throughout the country. There are 4 different themes that we are covering. We are covering peace and democracy, industry 4.0, health and well-being, and climate change. Recently, we were in Mumbai. We were covering the same topic that was in collaboration with the Bombay Municipal Corporation. And now we are here in Pune with the support of PES and SRGF, trying to collect as much information as possible and to feed it back into the policy ecosystem. The idea is to reverse the policy making process through the G20 platform. So by the time we reach the G20 proceedings in September, we have an all-inclusive agenda where we can have policies that could impact all of us in a manner that it would really affect us. RIS, our think tank, it's a 40-year-old institution. It is housed in the India Habitat Center. Our idea is that we make the entire deliberation more articulate before feeding it into the policy ecosystem, in this case with the Ministry of Youth Affairs. We've been going around, 2 of the mandates that we have. One is G20 University Connect, and the second is the Y20 Brainstorming Session. As part of the G20 University Connect, we are covering 75 universities across the country, 53 locations. The idea is that the G20 meetings are happening in 53 different cities. So every city that has a university, which being most of them, is going to host a G20 University Connect deliberation. I was in Pune before as well with the chief coordinator of the G20, Dr. Harsh Shringla. The lecture was held at Symbiosis International University with close to 1,000 students attending the seminar. And now here I am again for the Y20 brainstorming session, trying to take back to Delhi with something new connected more to the health and well-being. The idea is for all of you to connect as much as possible. We are going to have a rapporteuring report by the end of it, and that is going to be handed over to the Ministry of Youth Affairs. So once again, welcome you all. Thank you again, Varun. Thank you again, my colleague, Dr. Chaitanya, who is here. Hope to have a thrilling discussion. Thank you very much.
Thank you, Ali, for letting us know about RIS. And before we proceed, I must say that it is the jointness and collaboration such as what we are seeing at this event, where we have RIS from New Delhi and a very new and an ambitious non-profit such as SRGF, and of course PES, who are helping us put an interaction such as this one together. And this is what, as Ali mentioned, will help us reverse the policy process and to actually create actionable insights into what we can do for the future. So now I would like to welcome Professor Chaitanya Giri, who is going to be chairing today's session. Professor Giri is both an associate professor at Flame University, Pune, as well as a consultant at RIS New Delhi. So I'll hand over to Professor Giri now, who will lead you into the session.
सर्वप्रथम सगळ्यांना नमस्कार. हा कार्यक्रम केंद्र सरकारने प्रायोजित केला असल्यामुळे आणि तो स्ट्रीमिंग होत असल्यामुळे यापुढील जे काही संभाषण होणार आहे ते हिंदीत किंवा इंग्लिशमध्ये होणार आहे. सो आत्ताच सांगून देतो. जरी ये जो कार्यक्रम है आज का, जैसे अली ने बताया, जैसे वरुण ने बताया, डिजिटल हेल्थ इंफ्रास्ट्रक्चर से संबंधित है. और इस कार्यक्रम में हमने बहुत ही विचारपूर्वक पुणे के जो आईटी सेक्टर से निर्मित जितने अपॉर्चुनिटीज़ होते हैं और बायोटेक, फार्मास्यूटिकल, लाइफ साइंस इंडस्ट्री जो है शहर की, उन दोनों का संगम बना के कुछ नए सॉल्यूशंस या फिर नए सुझाव क्या हम भारत सरकार को दे सकते हैं. इस विचार से हमने ये मंच हमारे स्पीकर्स को और हमारी ऑडियंस को प्रस्तुत किया है. दिस प्रोग्राम हैज़ बीन थॉट फ्रॉम द पॉइंट ऑफ व्यू दैट आफ्टर द पैंडेमिक there has been a lot of churn happening in the Indian innovation sector. The month of March of 2020 triggered an unforeseen response, a response that we were not ready for. It was a black swan event. ये ऐसी घटना थी जिसके बारे में हमारी तैयारी नहीं थी. हमने इस घटना के लिए कोई पूर्व से कोई प्रयास नहीं किए थे और अचानक ऐसी आपदा में हम जब समय के कारण ढकेले गए, एक क्षति जो निर्माण होने लगी, उससे हमें ये पता चला कि कैपेसिटी बिल्डिंग शहर में होना, इस शहर में या फिर भारत के किसी भी अन्य शहर में होना बहुत ज़रूरी है. अब तक, नाउ आई एम मेकिंग अ वेरी पर्टिनेंट जियोपॉलिटिकल स्टेटमेंट. Most of our ecosystems, innovation ecosystems in the country, have been developed in such a way that the source of the innovation has not been India. Rather, we were playing second fiddle to whosoever was supplying us with the innovations. So particularly we were looking to Europe, we were looking to the United States, we were looking to Japan, we were looking to other European countries independently. So be it France, be it Germany, Switzerland, so on and so forth. And what you see around us in Pune right now is an ecosystem filled with these players. They employ thousands and lakhs of our youth. But given the circumstances that are emerging, given the crisis in which Eurozone is finding itself, just 2 days ago, Eurozone declared that they are into a state of economic recession. And that might culminate into some sort of economic depression in the coming months and coming years. And this is not a knee-jerk development. This has happened because of weak policy making on their behalf. At the same time, COVID-induced economic tribulations. And after that, the tribulations that are emerging because of the Ukraine crisis. इसका मतलब ये होता है कि आने वाले समय में हमें स्वावलंबी बनना पड़ेगा. हमें आत्मनिर्भर भारत को सिर्फ एक ब्रीद वाक्य ना रखते हुए उसको आत्मसात करना पड़ेगा. और उस आत्मसात करने की प्रयास में हमने आज का ये विषय रखा है डिजिटल हेल्थ इंफ्रास्ट्रक्चर का. कोविड के दरमियान हमें ये जान पड़ा है कि हमारे पास मेडिकल टेक्सटाइल्स की कमी थी, हमारे पास मेडिकल डिवाइसेस की कमी थी, पर उन कमियों को पूरा करते हुए डायग्नोस्टिक किट्स की कमी थी. उन कमियों को पूरा करते हुए हमने डायग्नोस्टिक किट्स बनाए. हमने वैक्सीन इस शहर ने ना सिर्फ इस शहर को ना सिर्फ इस देश को दिए, बट ये दुनिया भर में यहाँ से वैक्सीन चले गए हैं. तो शहर की हमारे तूती बोलती है, we have a definite potential in this city. Now we have to look at it from a point of view that this place is the origin, it should be the birthplace of innovation. ना कि innovation जो west से आ रहा है और यहाँ पे हम उसको री-इंजीनियर करके या फिर उसको री-डेवलप करके री-पैकेज करके यहाँ पे प्रस्तुत किए जा रहे हैं. बिकॉज हमने जब भारत सरकार ने G20 की शुरुआत की थी नवंबर में, उसी दरमियान एक प्रयास हुआ था जिसे कहा गया वॉइस ऑफ ग्लोबल साउथ. भारत ने खुद को वॉइस ऑफ ग्लोबल साउथ करके दुनिया के सामने प्रस्तुत किया है. इसका मतलब ये कि हमारे देश में जो इनोवेशन बनता है वो ना सिर्फ डेवलप्ड इकोनॉमीज के काम आ सकता है, because we can develop it, we can manufacture it here, we can process it here and provide it to them. Yet at the same time, we can make it so affordable that it can be given to the developing economies in Africa, in South America, in Oceania region, in Central Asia, in West Asia. And given the confidence that India has earned after the vaccine diplomacy, we have to take not just one step ahead, we have to go 10 steps ahead. And for that, सिटीज़ लाइक आर्स, पुणे जैसे शहर को काफ़ी अग्रसर होके इसके ऊपर कदम उठाने पड़ेंगे. और मुझे खुशी है कि प्रोग्रेसिव एजुकेशन सोसाइटी SRGF ने RIS के साथ हाथ मिलाया है और आज की इस संगोष्ठी को बिठाया है, इसको साकार किया है. एंड बिफोर आई पुट एनी ऑफ माई थॉट्स before you, I'd like to introduce you to the panel and I'll request all the panelists to come on the days one by one. So first I'd like to introduce Dr. Aniruddha Joshi. Dr. Aniruddha Joshi is the founder of Atreya Innovations और आज आप इनको सुनेंगे एक ऐसे विषय पे बात करते हुए. ये अत्रेय इनोवेशन के फाउंडर है. इट्स अ वेरी प्रॉमिसिंग स्टार्टअप. इनके प्रयास से हम, सर बैठिए ना, इनके प्रयास से हम आयुर्वेद को मेडिकल डिवाइसेस इंडस्ट्री के साथ जोड़ रहे हैं. इसके बारे में काफी कम लोगों ने विचार किया है. सो इंजीनियरिंग और आयुर्वेद इन दोनों का मिश्रण करने का श्रेय अनिरुद्ध की कंपनी अत्रेय इनोवेशंस को जाता है. उसके अलावा आई वुड लाइक टू इंट्रोड्यूस अनुपमा इंजीनियर, डॉक्टर अनुपमा इंजीनियर. शी इज द चीफ ऑपरेटिंग ऑफिसर ऑफ वी इनोवेट बायो सॉल्यूशंस. इनका एक फ्लैगशिप प्रोडक्ट है सिल्वोगार्ड, जो इन्फेक्शंस जो हॉस्पिटल में पनपते हैं, हेल्थ केयर रिलेटेड इन्फेक्शंस, इसके ऊपर एक काफ़ी कारगर सॉल्यूशन बना है जो ऐसे इन्फेक्शंस को रोकता है. किसी भी बीमारी के अलावा हॉस्पिटल में जो मृत्युएं होती है वो इन्फेक्शंस के थ्रू होती है, बिकॉज पेशेंट की इम्यूनिटी काफ़ी कम हो जाती है और उस इम्यूनिटी के कम होने के कारण द पेशेंट बिकम्स ससेप्टेबल टू सेकेंडरी इन्फेक्शंस. सो वैसी मृत्युओं को कम करने के लिए या फिर वैसे इन्फेक्शंस को कम करने के लिए वी इनोवेट बायो सॉल्यूशंस का जो प्रोडक्ट लाइन है वो काफ़ी महत्वपूर्ण साबित होता है. इसके अलावा आई वुड लाइक टू इंट्रोड्यूस डॉक्टर ऐश्वर्या पाकणीकर. शी इज़ द लाइफ साइंस कंसल्टेंट एट ईथोस डिजिटल. आपने ऑगमेंटेड रियलिटी, वर्चुअल रियलिटी का नाम तो सुना ही होगा, पर क्या ऑगमेंटेड रियलिटी और वर्चुअल रियलिटी जो आप आईवेयर पहनते हैं उसके थ्रू क्या आप किसी पेशेंट की मदद कर सकते हैं, या फिर क्या आप लाइफ साइंस इंडस्ट्री को जहाँ पे ड्रग इनोवेट करना पड़ता है, कोई मेडिकल कंपाउंड इनोवेट करना पड़ता है, क्या वैसे इनोवेशन में AR VR का उपयोग हो सकता है, तो उसके बारे में वे बात करेंगी. देन वी हैव विद अस मिस्टर आशुतोष प्रचंड. आशुतोष जी इससे पहले पुणे के स्थित NCL के वेंचर सेंटर में कार्यरत थे और आज वे डायरेक्टर है नॉटी IP. नॉटी यानी जे मराठीत बोलतात खोडकर तसं नव्हे, नॉटी KNOTTY. इनोवेशन किसी भी प्रकार का हो वो काफ़ी कन्वोल्यूटेड होता है, वो काफ़ी कॉम्प्लेक्स होता है और उस कॉम्प्लेक्स जो पाथवे होता है इनोवेशन का, किसी भी इनोवेशन का, उसको सिंप्लीफाई करने के लिए इनकी कंपनी कई सारे स्टार्टअप्स को, MSMEs को मदद प्रदान करती है और एक बहुत महत्वपूर्ण रोल है. वेलकम. फिर मैं इनवाइट करना चाहूँगा मिस्टर सिद्धार्थ देसाई जी को. सिद्धार्थ जी है डायरेक्टर किशोर पंप्स के और हाल फिलहाल में CPC एनालिटिक्स, पुणे स्थित जो उभरती एक एनालिटिक्स की कंपनी है, उसके वो सिद्धार्थ वाटर गवर्नेंस प्रैक्टिस के वो लीड हो चुके हैं. तो वो उनका नया एक डेजिग्नेशन है. Siddharth will be speaking on how to prevent epidemics and pandemics by surveillance of sewage water. Sewage water को आप बार बार मॉनिटर करके क्या किसी एपिडेमिक को या किसी पैंडेमिक को रोक सकते हो? ऐसे विचार के साथ उन्होंने यहाँ पे आज आने का मन बनाया है. थैंक यू सिद्धार्थ. And then we had with us Miss Varsha Rohani, but unfortunately due to some unforeseen circumstances she had to regret. Varsha अगर वो आती तो यहाँ पे वो use of artificial intelligence in managing clinical records, इसके ऊपर वो बात करने वाली थी. हालांकि अगर वो यहाँ पे उपस्थित नहीं है, पर उन्होंने जो हमारे साथ कुछ पॉइंट्स बांटे हैं वो in the process of the conversation we'll place it before you. So with that, now I introduce, no, sorry, I have already introduced them. I'll invite Shri Aniruddha Joshi ji to come on the podium and give his intervention for 10 minutes.
Thank you, Chaitanya. Thank you, RS. A very small background. When I was doing my engineering, my father was not well, and we took the Ayurvedic treatment, and through Nadi Pariksha he was diagnosed and he was treated well. So as engineers we thought, ye hua kaise, right? So we are talking about well-being here, and the world, WHO is talking about the integrative health by combining allopathy with different types of alternative medicines. So I'll represent this particular section. Very quickly, we have a Nadi machine for Ayurveda field, first of its diagnostic systems, and we have treated more than 250,000 patients so far. And based on that, based on this journey, based on all statistical significance, I have written a few points. The first is with respect to integrative approach. So for overall well-being, I think what we really need is a very good combination of Rutucharya and Dinacharya. That is, every season is different, every day is different, every person is different, and as a personalized, complete health solution, we should make sure that we are adopting to it, and for which there is a need to create a huge database. So there is something called Ashtavidha Pariksha in Ayurveda, where you know, whenever you go to a doctor, they check how you are walking, how you are speaking, how you look, how you are answering the question, and so on. So these are different 8 diagnostic steps, and we wish that you know, from different cities, from different states, we collect a lot of data. In our studies, we have proved how Ekadashi is important. Okay, so through the large database of the Agni part, the digestive fire, by studying 25,000 people, we showed on every Hindu calendar day the person is different, and how fasting on Ekadashi really helps, how fasting on different days actually helps, why particular Ekadashi is important, for particular. So if we can collect data at a large scale, I think on state level, at Jilla level, Taluka level, and so on, we can actually find out how the communities are working, and as we just heard, how sewage will help. So similarly, how total well-being, how total understanding of a person can help preparing different policies at different Taluka levels and so on. The second is with respect to the health workers which are working around. So for example, ASHA workers, they are very burdened, and I think if we can take care of them to start with, further well-being of the society can be done. Again, we are talking about how you know, season-wise or month-wise or day-wise, some rejuvenation can be provided to them, all the health workers for that matter. If that can be done, it will further help the overall population. The main point which I want to make sure, wanted to contribute was with respect to mental health policy. Everyone is talking about it. Everyone is talking about mental health policy and non-communicable disorders. They are going to cover more than 70% of our population very soon. There could be diabetes, hormonal issues, blood pressure, and different types of mental disorders. It's going to attack us very soon, and we have to make sure that we really make sure that we prevent it right from there. And as we are in Y20, specifically with respect to youth, they are so burdened with respect to competitions, aspirations, careers, and so on. So when I was, just wanted to share, when I was in 20s, you know, Shah Rukh Khan used to say, Senorita, प्यार एक ही बार होता है, you know. And today Ranbir Kapoor is saying, प्यार होता 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 बार बार है, एक ही बार किया तो क्या होता है, right? So there is so much burden on the youth. So प्यार कितनी बार करे, घर कितने ले, career कितनी बार बदले. I mean, there is so much pressure. So I think we have to accept that there is going to be stress in different manner, and we have to accept it. We have to start solving that problem as soon as possible. In a way, you know, the polio campaign was run. तब भी वैसे लगता था कि कुछ लोगों को ही पोलियो होता है तो कैंपेन क्यों करना है, या जिसको होता है वो देख लेगा. So it's not like that. I think the whole nation in some way is going to get suffered through this. So we have to make sure that it actually gets run as nationwide campaign. And my last point is, and it specifically is run for men, the mental health, because we believe that men are stronger, but most of the times they are not. And we have to make sure that we are taking good care of them, and we also listen to them. So with that, I would like to stop a few points here, and during the discussions, I'll talk further. Thank you. Thanks so much.
जैसे कि आपको पता चला है कि हम यहाँ पे पॉलिसी रिकमेंडेशंस देने की कोशिश कर रहे हैं टू द Y20 सेक्रेटेरिएट. हमारे यहाँ पे जो सामने दिग्गज बैठे हुए हैं, दे कम फ्रॉम डाइवर्स सेक्टर्स. हमने जानबूझ के किसी मेडिकल डॉक्टर को इसमें शामिल नहीं किया है, क्योंकि आने वाले सत्र में हम SRGF के माध्यम से उनको शामिल करने ही वाले हैं. परंतु हम ये जताना चाहते हैं कि अब जैसे कि अनिरुद्ध बैकग्राउंड से इंजीनियर है, उन्होंने आयुर्वेद में प्रशिक्षण नहीं लिया है, पर एक इंजीनियर आयुर्वेद को कैसे देखता है, ये एक काफ़ी नया अप्रोच है. और ये नए अप्रोचेस हमें टैप इन करने हैं ताकि उसमें से आयुर्वेद को एक बढ़ावा मिल सके. आयुर्वेद सिर्फ आयुर्वेद की सीमाओं में चौकट में ना बैठा रहे, ताकि और उसको इंजीनियरिंग का साथ मिले, उसको आर्टिफिशियल इंटेलिजेंस, मशीन लर्निंग का साथ मिले, उसको डेटा एनालिटिक्स का साथ मिले, ताकि वो एलोपैथी जिस स्ट्रेंथ के ऊपर आज एक बलाढ्य स्थिति में जाके बैठा है, वैसी ही बलाढ्य स्थिति आने वाले समय में आयुर्वेदिक मेडिसिन की हो. भारत ने पिछले ही साल यूनाइटेड नेशन को, वर्ल्ड हेल्थ ऑर्गेनाइजेशन को भारत में गांधीनगर में एक ट्रेडिशनल मेडिसिन का सेंटर बनाने का न्योता दिया था. वो बन भी गया है. और अगर वहाँ से हमें इंटरनेशनल लेवल पे पॉलिसीज बनानी है तो हमें आयुर्वेद में झांकना होगा और आयुर्वेद को इमर्जिंग टेक्नोलॉजीज के साथ जोड़ना होगा. तो जब हम चर्चा सत्र शुरू करेंगे तब अनिरुद्ध के साथ उस विषय पर ज़्यादातर बात करेंगे. हालांकि उन्होंने सिर्फ आज अभी पॉलिसी रिकमेंडेशन ही दी है, उनके पास बातों का काफ़ी बड़ा पिटारा है, मुझे मालूम है. अब मैं बुलाना चाहूँगा सिद्धार्थ देसाई जी को, और वो अपना मनोगत यहाँ पे व्यक्त करें और उनके द्वारा जो पॉलिसी रिकमेंडेशंस Y20 को जाना है वो हमें बताएं.
Good afternoon, everyone. Thank you, Chaitanya ji, for introducing me, and it's an honor and a privilege to be a part of this esteemed panel. feel humbled being among healthcare experts and domain experts, because I come from a very different background. I come from a water technology or a water policy background. So we look at healthcare as an aspect within the water domain, and how the interplay of water and healthcare happens. So that is what we look at. Water's role in sanitation is very well known and very well established, but that's all that we have been looking at, the role of water in public health. There is much more to it, and one of the key areas that we are looking at now, as Professor Giri mentioned, is wastewater surveillance. The three particular aspects which I would like to highlight with regards to the role of water in public health I'd split it into three basic broad categories. One I would refer to as wastewater as an enabler for antimicrobial resistance, that's AMR, which is widely understood now and widely focused. The second is water as a storage or a repository of contaminants of emerging concern, or often referred to as CECs. I'll come to the details in a bit. And the third category is wastewater surveillance as a biomarker or an advanced warning system against community outbreaks to protect public health. So I'll go into the details of each three of these one by one. So coming to the first one, that is water as an enabler for antimicrobial resistance. How many of you know the term pandemic by now? I think it's a dumb, stupid question. Of course, everybody knows about it. But how many of you know what is being called as the silent pandemic? That is something that the World Health Organization has now been referring to, what is the antimicrobial resistance. What it essentially is that the antibiotics, the pharmaceuticals, the antivirals, the antifungals, whatever we have been developing for all these years, we are seeing that the bugs themselves are adapting to it. They're developing resistance against these medicines, and they are rendering them useless when they are direly needed. So in Marathi there is this old story about Langa Alare. So the bugs are trying to do that, something like that with the medicines that we have been developing. So the causes of antimicrobial resistance are manifold, but I would like to focus just on the wastewater aspect or the sewage aspect of antimicrobial resistance. So, we have a habit of just popping pharmaceuticals, nutraceuticals, antibiotics without much thought into how these compounds eventually interact with nature. We take them thinking that, whatever we are suffering from, that will go away, which is true, but that's a very short-term fix. What happens is, when we consume these medicines, not all of it is absorbed by the body, and some of it is excreted through urine and through stools, and they enter from these excretas into the sewers and the wastewater systems, and eventually the water bodies as well. Even if there is 100% sewage treatment, which is unfortunately not there in India as of now, but even in countries which have 100% wastewater or sewage treatment, even then these chemical or pharmaceutical compounds have found their way into the natural water bodies. Now, once these compounds are out there in the open environment, it's a playground for the microbes to learn what these compounds are, and they eventually develop immunity and resistance against against these compounds which were designed to kill them in the first place. So they adapt, they generate the immunity, and over time, as it gets consumed, they enter the food chain, the water chain, and that's the challenge that we are facing. How do we exactly deal with this? Well, first of all, we have to consume medicines when they are only absolutely essential. We should not consume medicines when they are not essential. Secondly, more importantly, which is regarding today's theme, that is digital public infrastructure or digital healthcare, there is an opportunity for government and private sector to develop an antimicrobial resistance monitoring platform, which can be looked upon something like a nationwide platform wherein data sharing happens across different different districts or different states, and the variants or the strains of the microbes which are known already to us, they are studied periodically. The periodicity is very important. They are studied periodically, and the red flags, if any, are escalated to the right level. So that is something, an opportunity in terms of the digital health, which can be looked at, which can not address AMR, but at least have some, I would say it can have some kind of advanced warning system, which can enable the healthcare experts and professionals to act accordingly. So wastewater as an enabler for antimicrobial resistance, that's the first point. The second point I would like to highlight, which is unfortunately not a large topic of discussion as of now, which is wastewater or sewage again as a storage, or I would rather call it a repository of contaminants of emerging concerns, that is the abbreviated as CECs. Excuse me. Now CECs, how they are, what the water professionals refer to CECs, that is contaminants of emerging concerns, as contaminants which are already found in the environment, in water bodies through the sampling system. They are known to have some adverse health impacts on humans, but they are not regulated under the current environmental laws, nor we know much about how much concentration or the threshold at what point they start affecting human health. So this is kind of the classic unknown, wherein you know something that is wrong, but you have no clue how that's going to affect you, nor when it is going to affect you. So that is a challenge of the contaminants of emerging concern. And what are these contaminants? Well, the humble shampoo, the humble detergents, the humble soaps, the humble cosmetics, kitchen cookware, which are the chemicals that are used in kitchen cookware, like non-stick pans. You know, the chemicals that go into the manufacturing of these items, they eventually make their way into the sewer systems, the environment, and they are not necessarily removed or degraded into the in the wastewater treatment plants. Over time, their concentration build up, and the tricky part or the challenging part is we don't know at what concentrations they start affecting human health as of now. There is some study going on, but again, it's not a topic of global discussion to the extent that it needs to be. There is recently the United States brought regulation for one of these CECs, what is often referred to as PFAS, that is perfluoro and polyfluoroalkyl substances, which are in regular jargon called as forever chemicals. The reason they are called forever is because they don't break down or it's very difficult to break down. But at least now there is a regulation around the discharge norm that can be done. Now the technologists have to look at how these need to be looked at, how these can be removed. Because right now the infrastructure that we have for wastewater treatment, more than 95% of these plants are incapable, not in India, globally, not capable of removing or addressing any of these contaminants of emerging concern. So that's the second challenge that we're looking at. And by the way, the known impacts of CECs are as they act as endocrine disruptors as well as carcinogens. The challenge again is we don't know in what concentrations they are harmful yet. So that's the challenge that we need to face. Again, what is the solution to that? Well, everyone is trying to find out. One is again, consume less shampoos, consume less soaps. Well, it's easier said than done, but for now, till we have a better solution, that's the only approach we can take. And the third aspect of how wastewater interacts, or the interplay of wastewater and public health, is the wastewater surveillance as a biomarker or an early warning system for community outbreaks to protect public health. In fact, it's a delight for me to mention here as well that a Pune-grown startup, the name of the company is Fluid Robotics. It's the founders Nidhi Jain and Asim Bhalerao, both based out of Pune. They have been doing this for a while. They have developed the technology to monitor the sewers through robotics and the analysis. And during the COVID pandemic, actually they were working with NCL and the National Institute of Virology to identify some of the strains that were there in the sewage. Now, how does wastewater surveillance work? Well, basically, it's a community-level surveillance of the viral strains that are there in the sewage, because the biggest challenge with COVID-19 pandemic was that most of the cases were asymptomatic, or not most, but large portion of the cases were asymptomatic. So we were not, so the health officials had a huge challenge understanding who is infected and who is not, because they were just not showing symptoms. Critically, the sewage samples that were eventually collected from these sites, not just in India, again globally, they showed these biomarkers much well in advance to the community outbreak. So if there is a community with, let's say, 100,000 people, the sampling of the wastewater systems or the wastewater sewers coming from that community, when they were sampled, they found that the SARS-CoV-2 strain was present in those communities, and over the next 2 to 3 weeks, that they observed a community outbreak in that locality. So this is how wastewater surveillance works. It need not be only for COVID pandemic or the SARS-CoV-2 strain, but that's how it started. India has done a lot of work on wastewater surveillance as well. The challenge going forward is how do you integrate that data in a nationwide system which can provide the red flags when they need to be shown. So that is where I think the policy recommendations need to come in, that how do we integrate the fragmented data that is already being collected some of the places and try to give a direction with an integrated approach to the platform, and develop a platform to alert the health officials whenever needed in advance, so that the large community outbreaks can be prevented in the future. So that was some of the interventions that I think, with the limited knowledge that I have of health, I could think of. So thank you again for the opportunity, and I look forward to the discussions. Thank you.
Bodily health is connected with the health of the environment that surrounds you. इसको बड़े पैमाने पे G20 पटल पे प्रमोट किया जा रहा है. प्रधानमंत्री का जो कॉल है लाइफस्टाइल फॉर सस्टेनेबल एनवायरनमेंट, लाइफ, इसके बारे में अगर आपने सुना होगा तो सुना है बच्चों? नन ऑफ यू? सो अगेन लाइफस्टाइल फॉर सस्टेनेबल एनवायरनमेंट के बारे में भी सर ने अभी बात की. उनका ये कहना है कि हम अगर कॉस्मेटिक्स का इस्तेमाल या फिर कुछ दवाइयों का इस्तेमाल जो आप घर में इस्तेमाल करते हैं, खासकर बर्तन धोने के लिए आपके किचन में, इन योर बाथरूम्स, इफ़ यू reduce the consumptions, or if you moderate the consumption of these kind of compounds, the forever chemicals that reside within these substances, that will sort of alleviate its negative impact on the environment. सर ने बात की on surveillance of sewage systems. हमारे sewage systems अभी भी integrated नहीं है. There is a lot of runoff into natural water bodies, into lakes, into rivers. हमने हमारे तालाबों की परिस्थिति देखी है. इट्स नॉट इन गुड शेप्स, नन ऑफ द रिवर्स आर इन गुड शेप्स. और फिर जब ऐसी बात आती है कि बायोमार्कर्स और वहाँ से जो मंडराने वाला जो खतरा है, दैट शुड सॉर्ट ऑफ मेक अस थिंक अबाउट द डेंजर्स दैट सराउंड अस मोर सीरियसली. इसके लिए हमें घबराना नहीं है. व्हाट वी हैव टू डू इज वी हैव टू वेरी केयरफुली सॉर्ट ऑफ contain the entire sewage systems in a way that it becomes easy to monitor. Number one, if there are any harmful chemicals or compounds that are flowing into the sewerage, into the wastewater, they remain confined in the sewage pipelines. They don't run off into lakes and rivers. और अगर तालाबों में, नदियों में, समुद्र में अगर वो केमिकल्स जा रहे हैं तो डायरेक्टली और इनडायरेक्टली, स्पेशली दोज हु आर पाइसिटेरियंस, आप फिश खा रहे हो या फिर आप ऐसे जानवर को खा रहे हो जिसने वहाँ का पानी पिया है, इट्स अगेन गेटिंग बैक इनटू योर ओन सिस्टम. सो यू आर एक्चुअली गेटिंग इनटू अ विशियस सर्कल. सो टू अवॉइड दैट विशियस सर्कल, वील हैव टू think on the matters that you've just spoken seriously, and at the same time come up with new mitigatory mechanisms. कोविड के समय हमने कंटेनमेंट जोन्स के बारे में काफ़ी सुना होगा कि इस बिल्डिंग में जाना नहीं है, इस हॉस्पिटल के करीब जाना नहीं है. क्यों नहीं जाना है? क्योंकि वहाँ पे आपको इन्फेक्शन होने के चांसेस ज़्यादा है. और अगर आप एसिम्प्टोमेटिक कैरियर है तो आप किसी वहाँ पे बेचारे इन्फेक्टेड को, जिसकी इम्यूनिटी ऑलरेडी लो है, उसको आप इन्फेक्शन दे जाओगे, जो आप नहीं करना चाहोगे. आप किसी की जान नहीं लेना चाहोगे, डायरेक्टली और इनडायरेक्टली. सो इन सच सर्कमस्टांसेस इन्फेक्शंस become very important. How to mitigate those infections becomes an important task at hand. And to discuss about infections, we have Dr. Anupama, engineer. Ma'am.
Thank you so much, Professor Giri, for the kind introduction. I must say that this gentleman sitting over here stole my show, spoke about AMR. So let me give you a brief. Absolutely fine. I'm glad that this indicates that although we come from diverse backgrounds, there is a very nice integration that do exist between the so-called diverse fields that we are all representing today. So let me give a 2-minute brief background of what we are doing. So me and my 2 colleagues, we did our PhDs in the year maybe 10 years back. And that time there were 2 trends. One of the trend was you do your PhD in India, go abroad for a postdoc, and then get a good academic position and life is settled. There was one trend. Second trend was, as he correctly said, we were discussing in just before the panel started, that we are seeing a lot of Indian technologies which are being bought by foreigners and then made into a product, and then they come back to India and they sell the same technology that we have developed at a price which is affordable to only a cream of nation. So we identified this. We realized that there is a brain drain which is happening. We sitting over here have the potential to develop a technology which is of a global scale. So why aren't we doing something about it? That's how we jumped into the so-called startup well, and that's how our journey began. So talking about my startup, We Innovate Biosolutions. We work in an area which was not known to anybody previously. So we used to call ourselves before 2020 as the unsung warriors of the healthcare systems, because nobody cared a damn about us. Because what were we doing? We were working on infection prevention. Nobody knew about infection prevention until a simple infection caused by a virus attacked us and showed us the repercussion of what happens when you ignore an infection, when you can ignore a virus. So that's how we got into the limelight. Now, talking about infection prevention, We Innovate Biosolution works in a triangular methodology. We have developed a system wherein we are trying to avoid infections happening at per se. I'll come to it slowly. So my tagline is prevent the preventable. Now, how is this entire AMR happening? Let's understand that. So you have infections which are happening to a patient. When a patient goes to a hospital, the patient is being attacked by some or the other microorganism, and the patient gets an infection. There are different kinds of infection. Now, to treat the infection, of course, the doctor gives antibiotics. Now, these antibiotics which are given, they are often given empirically, they are often given based on presumptive tests, they are often given based on the symptoms that the patient is presenting, and very little is known about what actually is causing that infection. So because of these use of antibiotic, I will say overuse, indiscriminate use, what is getting rises? The rise of superbugs. Superbugs are those microorganisms which have the ability to surpass any antibiotics that they are exposed to. Today, I have cough and cold. If I go to a pharmacist and if I say कि थोड़ा गले में खरखर हो रहा है, I'm sure he is going to prescribe me an antibiotic, OTC. That has to stop. So I am taking that today. And when I say an OTC antibiotic, it is something like amoxicillin and clavulanic acid, which is one of the very higher generation antibiotics which is used to treat critical infections in hospitals. So I, as a user of that OTC antibiotic, I feel okay in 2 days and I stop my course of antibiotics. This negligence on my part is also contributing to AMR, antimicrobial resistance. As rightly said by him, WHO has announced that we are all sitting here on a silent pandemic which is brewing right below our noses, which is nothing but antimicrobial resistance, the rise of superbugs. What can we do about it? So there are 3 ways which we can do about it. First is, we have developed a technology called as SilvoGuard. It is basically a range of medical devices which are antimicrobial in nature. So one of the major component of why an infection happens in a hospital is because of the use of interventional devices. So when you go to visit a patient in the hospital, you see a lot of tubes coming out of the patient's body and going inside. So they are basically channels, because that part of the body is exposed outside. So it's very easy for the bacteria to gain access inside the patient's body and then cause an infection. So we thought, why can't we stop these infections from happening in the first place? As a standard procedure, antibiotics are administered when a patient is on any kind of these interventional medical devices. Is there a possibility that we can stop the usage of this antibiotic? Is there a possibility that we can stop these kind of hospital-acquired infections happening from first place? Yes, there is a possibility. There is a possibility when we use a technology such as SilverGuard, which is going to be an antimicrobial medical device. Now what happens is we don't use antibiotics over here. Now when there is no usage of antibiotics, the bacteria are not exposed to the antibiotics. Because they are not exposed to the antibiotics, they do not have a chance to alter their gene mechanism and come out with a cheater population, what we call them as superbugs. So it's a vicious cycle. We need to break the chain. Now again over here, I'll take experts from even Mr. Joshi, that Ayurveda has a role to play. India has a traditional knowledge. It has immense, we are sitting on a very immense traditional knowledge currently. You know, all our Ayurvedic knowledge that we have, I'm sorry to say, but Western world are exploring it more than we are doing. What we are doing in this antimicrobial medical devices, we are using silver. If we have all had our first spoons of water with silver spoon in a glass, there is a logic behind that. Silver is a beautiful molecule. It has an excellent antimicrobial activity, and what's the beauty of it is it's sustainable. So we at Innovate Biosolutions, when we are developing a technology to address the issue of infection prevention and antimicrobial resistance, our first aim is to develop a technology which is sustainable. Means infections were not new to us. So to tackle those infections, we started churning out antibiotics, first generation, second generation, third generation, fourth generation antibiotics. What did we do in this? We only looked at treating that infection. Did we look what's happening besides that? Did we ever envisage that there is a antimicrobial resistance which is getting co-created by the use of the very same antibiotics which is actually used to treat an infection? So now it is a time to think about sustainable development even in this area. Like if I'm not wrong, there are hardly 10 or 12 new antimicrobial agents which are getting, which are there in the pipeline. This is again a statement by WHO, which are there in the pipeline which are used to treat infections. And out of this, I am very scared to say that only 2 are novel molecules. Rest all are the permutation combinations of the existing combination chemistries of the organic molecules that we have. If we use a technology like silver, which is an inorganic molecule, which has a proven efficacy for broad spectrum antimicrobial activity, which is around us in our mother nature, mother earth, and which can help us solve the issue of infections, should we not resort to these things? And lastly, the third point that comes from the infections to antibiotic is the rise of superbugs. They are linked to each other. So talking about specifically about digital healthcare, we are also working on a platform. We have developed a platform called as Rapid. Now this is a digital healthcare platform. It's a diagnostic tool. Now this tool doesn't worry about what is causing the infection. If I am a doctor and if my patient has got an infection, my primary concern is to which antibiotic will heal him, which antibiotic will treat him. So I need to know the AST pattern, the antibiotic susceptibility pattern of the particular causative agent. So we have developed a platform technology in which you merely have to load your biological sample, and in 20 minutes time you will come to know what is the correct dosage, what is the correct type of antibiotic that the doctor needs to prescribe. It's a palm top device, it's a battery operated device and other USPs. So what I'm trying to say is that we need to now corner these superbugs and this AMR wave from all angles. Not just by inventing or discovering better or novel antibiotics, not by just by improving our surveillances and by improving our diagnostic platforms, not just by using medical devices. When it all comes together, I'm sure there is a victory around the corner. Specifically talking about digital healthcare, I have like a couple of policy recommendations. So to begin with this, there is a fad when it comes to digital healthcare. Everybody, most of the digital healthcare platforms that I have come across, I may be ignorant in this, is about data collection and analyzing and surveillance and monitoring. We just heard a couple of minutes back that there was a data surveillance which took place, and in 2 or 3 weeks time, Based on that very same data surveillance, it was a eureka moment. Oh yeah, we did realize that this community may be standing at an outbreak, and that yes, the data surveillance was bang on correct. That community did get the outbreak on 2 to 3 weeks. Could we prevent it? What is important for us to prevent it or to know that the enemy is coming? We know it's very important for us to know that the enemy is standing right the corner. It's equally important for us to know how we are going to prevent this enemy right there, so that we don't have to resort to mechanism which is giving us a collateral problem of antimicrobial resistance. So what I recommend is that, one of the recommendations when we talk about any digital healthcare platform, one of the primary aims of that platform should not be just surveillance, should be also focusing on data-driven AR recommendations. So if I have collected a plethora of data, which we have now, can we not have recommendations for our doctors, for our physicians? Can we not have that rolled out for them to know, okay, if this is thing, I have to stop using this. If this is the case, this is what I have to resort to. Can we not do that? Can we not prevent? That's first thing. My second policy recommendation for any digital healthcare platform is sustainability. It is the only thing that, see, we are all sitting here in this hall, the only thing that we can give to the next generation is carbon credit. We cannot give them beautiful infrastructure, we cannot give them best of the education, we cannot give them best of the play zones and movie exposures and whatnot. What they will need and what we can give them today for what we need to prepare is carbon credits. For that, it is very important that any innovation, any technology development that we do has sustainability as one of the prime aspects in its development. When I am writing a project to develop a tool, one of the outcomes of that project is it has to be a sustainable project. It has to bypass the hazardous chemicals, or it has to bypass the use of technology. For example, I'll just ask you, I'll ask a simple question if I have time, last 1 minute. How many of us have got the Gmail notification that your inbox is full, out of storage? What do we do about it? Do we pay and take the extra storage? We don't do it. We either go back in our leisure time and delete the extra emails, the photos, the videos, or if we are really having that kind of a knack, we open a different Gmail account and we link and all that thing, right? We don't pay. Why? It's a very simple, if I'm not wrong, it's 150 per month, correct? But we don't make that payment. Can you imagine everybody around the room is using ChatGPT or using these AI platforms? What is the amount of portable water which is being used to keep this data? Data is being stored, right? It is being stored. There is an entire cooling system which goes in this data storage. The entire information pollution which is there around us because of the internet and the 4Gs and the 5Gs of the world, that's churning out data. We have technologies like you map your genome and you have your personal genome, and now you know 15 years from now whether I'll have cancer or no. Can you imagine the data which is reflecting my own personal genome just to get an idea whether I'll have cancer or no? To protect that data, to save that data which is there on the cloud, in the hard disks, in some or the other format, right? The data is existing, right? It requires storage. I may not be wrong, but gallons of water, billions of gallons of water are used to cool these systems where these kind of cloud data is being stored. Here, there is a need of sustainability. So a digital healthcare platform which can effectively manage the data. Data management is very important. Data collection is just the first step. Data management is a very important challenge, and it's a very important aspect that any digital healthcare platform should consider right from its conception level. This is my humble recommendations. I'll be very happy to discuss them in details. Thank you so much for the opportunity.
थैंक यू अनुपमा जी. आपने जब सिल्वर के बारे में बात की, अंग्रेज़ों की एक कहावत मुझे याद आई, बॉर्न विद अ सिल्वर स्पून. उसका कुछ महत्व हुआ करता था उस कहावत का कि बचपन में आप जब छोटे होते हो, जब आपको कुछ खिलाया जाता है, पहला आपका निवाला, then silver spoon is much needed. That helps you with a lot of preventing a lot of infections in the childhood. जब आपने एंटीबायोटिक्स की बात की, सर आपने भी जब की, तब मुझे एक बात याद आई और एक सवाल याद आया जो मैं आपसे पूछना चाहता हूं कि सबसे पहला एंटीबायोटिक, खासकर बच्चों से, सबसे पहला एंटीबायोटिक किस समय इजाद हुआ था, इन्वेंट हुआ था, एंड व्हेन वाज इट फर्स्ट यूज्ड? एनीबॉडी? First antibiotic and when it was innovated, when did it come into the market? चलो कोई नहीं. Penicillin, 1920s, World War. Focus on that word. ये वर्ल्ड वॉर के समय का इनोवेशन है. इसका मतलब even the antibiotics are a product of the fighting that has happened in the West. It's a product of destruction, it's a product of war, जो हम अब तक धड़ल्ले से इस्तेमाल करते जा रहे हैं. धड़ल्ले से हमने कभी सोचा नहीं, because we haven't started to introduce or insert our Indian ethos, और इंडियन वे ऑफ लुकिंग एट साइंस अंटिल नाउ. हम बड़े आराम से, बड़े लीजरली हम वेस्टर्न टेक्नोलॉजी, वेस्टर्न प्रोडक्ट्स को इस्तेमाल करते जाए, एंड सी वेयर हैव वी कम. वी हैव कम टू द सिचुएशंस दैट आर फेलो पैनलिस्ट हैव मेंशन्ड. जब आपने बात की इन्फेक्शंस की, खास करके डिवाइसेस, व्हेन यू यूज सिल्वर इन मैन्युफैक्चरिंग योर डिवाइसेस, दैट इज अगेन नथिंग बट your traditional knowledge being plugged into medical device technology. ये सिर्फ भारत में ही हो सकता है, ये कहीं और नहीं हो सकता है. और इसे हमें, वापस कह रहा हूं, इसे हमें ग्लोबल साउथ में लेके जाना है, इसे हमें डेवलपिंग इकोनॉमीज में लेके जाना है. क्यों? क्योंकि जो नुकसान, जो चीजें, जो दुर्गति हमें आज यहाँ पे महसूस हो रही है, अच्छा, जिसके लिए हम काम भी कर रहे हैं, शायद ग्लोबल साउथ के कुछ ऐसे देश होंगे जो उसके ऊपर इजाद नहीं पा सकेंगे. मे बी दे डू नॉट हैव द नेसेसरी wherewithal, दे डू नॉट हैव द नेसेसरी टैलेंट टू ओवरकम दीज सॉर्ट ऑफ इश्यूज. आपने इबोला के बारे में सुना है, आपने हेमोरेजिक फीवर के बारे में सुना है, अफ्रीका के. कई सारी ऐसी बीमारियां हैं जहां पे अफ्रीकन पॉपुलेशन खुद उसके ऊपर कंट्रोल नहीं पा सकती. उसके लिए फिर उनको WHO का साथ या फिर ट्रांसनेशनल मेडिकल फ्रेटर्निटी का साथ उनको लेना पड़ता है. क्या हम कुछ ऐसी टेक्नोलॉजीज ला सकते हैं जैसे आपकी है, जैसे आपका सर्विलेंस का जो नाड़ी तरंगिनी है, क्या हम इसको ग्लोबल साउथ में लेके जा सकते हैं? ये अगर हम कर सके तो ये भारत का एक काफी पुराना सपना है. ये काफी पुराना सपना पूरा होगा. जिस आशादायी नजर से हमें कई सारे देश देखते हैं कि भारत हमें कुछ दे सकता है, उस नजरिए को पूर्णत्व की ओर लेते जाने के लिए ये सारे सॉल्यूशंस काम आने वाले हैं. ये सारे और इनसे भी कई और है जो हम आने वाले समय में डिस्कस करते जाएंगे. तो इसके ऊपर थोड़ा सा गहन विचार मैं आपसे रिक्वेस्ट करता हूं कि आप करना शुरू कीजिए, और इसे हमें सिर्फ ऐसे टू एंड फ्रो कन्वर्सेशन में नहीं रखना है, इसको हमें अमल में लाना है, इसको हमें प्रैक्टिस में लाना है. आप आगे चल के जो बच्चे हैं जब नौकरियां करने जाएंगे, मेक श्योर दैट यू कीप ऑल दीज थिंग्स इन माइंड. क्योंकि जैसे उन्होंने कहा, वी आर सिटिंग ऑन अ स्लीपिंग पैंडेमिक. वो कुंभकर्ण जब जाग गया तो फिर किसी की खैर नहीं होगी, एंड इट विल बी अ मच डेडलियर थिंग टू हैपन देन व्हाट कोविड वाज. और कोविड ने हमें अच्छी तरीके से डरा के रखा था. सो विद दैट, नाउ आई इनवाइट onto the days Aishwarya Paknikar. She will be talking about what happens when you get into hospitals. एक बार आप हॉस्पिटल में जाने के बाद आपको तंदुरुस्त करने के लिए, आपको मेंटल, आपकी स्वास्थ्य अच्छी रखने के लिए आप क्या क्या कर सकते हैं. एंड फॉर दैट शी इज कमिंग अप टू यू विद सम AR and VR solutions.
Thank you, Dr. Chaitanya, for this kind introduction. And first of all, I'll really like to thank SRGF and PS for organizing this one-of-a-kind event. And I'm extremely honored to be a part of this esteemed panel from diverse backgrounds and with very interesting conversations. So just to give a brief background of what I do. So I'm a subject matter expert at Ethos Digital, where we create immersive experiences for the healthcare and life science sectors through the use of emerging technologies of augmented reality and virtual reality. So I'm pretty sure you've all heard about what augmented reality and virtual reality is. So just to simply put it in one sentence, augmented reality is the use of or projecting virtual objects in your real physical world, in just in front of your field of view. Whereas a virtual reality is creating an immersive environment which is simulated and controlled, and so you basically can enter into that environment and be in the driver's seat and explore that environment. So how can we adopt these technologies in our real world scenarios? So the first thing that I can think of is using these technologies in medical education and training. So just imagine that there are medical students, they are learning about human anatomy in a class. If we had an AR application where you can project the human anatomy right in front of you, where you can view the human body in a 360-degree angle, you can basically relate to those medical concepts that you are learning, and you will be able to better understand what our human anatomy is about. Also, virtual reality, it can be used in surgeries for training for surgeries. So I can basically go in a operating table environment. I can wear my VR set goggles and I can perform surgeries. I can train on how to operate on humans and develop my skill sets without being anxious about the outcome of the patient or their safety. Normally what we do is we actually work or teach on real patients, but there's always a risk of outcomes in that patient. So to mitigate that, we can basically work in a simulated environment and develop my skill sets, and then you reduce the errors that I might cause while performing those actual surgeries. So that's definitely something that the undergrad medical education system can think of adopting AR and VR technologies in the curriculum. Another point that we can think of using these technologies is in the patient management and rehabilitation. So like Mr. Aniruddha mentioned, mental illness, it's one of the very upcoming problems of our times. And most of the times using drugs is actually makes it worse. So always medical practitioners are in the search of more alternative approaches, more holistic approaches that can work. So just imagine that patients who suffer from neurological disorders or some psychological disorders, who have phobias, they enter into an immersive environment in which they can relax, they can reduce their stress, they can meditate, they can overcome their fears or phobias, and all from the comfort of their own home. So this is something that medical practitioners or any healthcare facilities can definitely adopt for better patient management and their rehabilitation. Also, another thing that these technologies can be used is for patient awareness and education. So what happens is, most of the times, let's say I am a patient and I have been diagnosed with a medical condition, and I am anxious. I have a fear of, I don't know what's going to happen, how I'm going to be treated, or what are the procedures that the doctor is going to be using on me. So if I had the information at my hand, if I knew or if I could see what those what my medical condition is and how is that doctor going to use the medical procedures and how I'm going to be treated, I would instantly, understand what's going to happen with me. I'll be at more ease, and it would help me inculcate a sense of trust in my doctor and of course in that healthcare facility. So that will definitely expedite the decision-making process that these healthcare facilities sometimes face, because the patients delay the treatment, and that's not good in their interest. So that's another scenario where we can use AR and VR technologies. And lastly, there is a very upcoming concept called the concept of developing digital twins. So digital twins is basically just a virtual imitation of either a human body or even a lab environment or a healthcare setting, or basically absolutely anything that you can think of. And these digital twins can be used for, let's say, developing, for researchers and medical practitioners. They can make a digital twin of the human body. They can study their genetic makeup, the physiological state of the human body, and they can use it for developing drugs which are low cost and which are safe. Or if there are healthcare facilities who create digital twins of their healthcare environment, they can basically analyze the strategies, they can track their medical supplies, their staff, or bed capacities, and eventually prepare themselves in the case of pandemics, just like COVID. So of course it's not the first pandemic that we have encountered, and it won't be the last one. So they can prepare themselves for all these upcoming challenges. And for all of these emerging technologies to work in our digital health infrastructure, we need to go to the very grassroots level. So for understanding how these technologies are made, we need to understand the basics of what goes into it. And for this, I would definitely recommend you recommend certain techniques or certain subjects that have to be included in our education curriculum. So it starts with knowing about programming languages, knowing about 3D tools, knowing about user interface and user experience design, game development, video and sound production. So all of these things should be included in our basic curriculum, and our youth should be educated right from their school level or their undergraduate level, and this is how we can boost the use of these technologies in our digital healthcare structure. And organizations like us at Ethos Digital, we are happy to assist in developing these curriculums, and I'll be happy to discuss about this in this session. Thank you.
Thank you very much. मुझे अनिरुद्ध जी की बात याद आ रही थी अभी, और मैं मन ही मन मुस्कुरा रहा था जब वो शाहरुख खान और रणबीर कपूर का उदाहरण दे रहे थे, और मैं ये सोचने लगा कि अगर शाहरुख खान की और रणबीर कपूर की फिल्में अगर ना चले तो बेचारे जो टेक्नीशियंस है वो क्या करें, वो जो साउंड रिकॉर्डिस्ट है, जो एनिमेटर है, वो क्या करेगा? तो वो AR/VR में आएगा, वो वहाँ पे काम करेगा. So what we have to do is we have to find multiple opportunities for these professionals. तो इसीलिए I'll again reiterate to the fact that we deliberately did not invite medical professionals, and not for any malicious intent, but our only intention over here was to present before you a community that is peripheral to the medical sector, that may not be directly associated with it. You may not relate them with the medical sector, but they are perhaps the most important stakeholders coming up to assist the medical sector. And for that very reason, we've chose the theme, as Varun said, promoting digital health infrastructure. And that's why this esteemed gathering before you. आपने जब AR/VR की बात की and about curriculum, see, again, we are discussing things right from palliative care, which means care to terminally ill patients, care to patients that have certain mental conditions. We are talking about curriculum development. We are talking about bringing in Ayurveda into mainstream engineering and Industry 4.0. We spoke about surveillance. We spoke about data, what to do with massive amounts of data. और medical records जब create होने लगते हैं, it's enormous data sets. आप आपके खुद के अगर सोचिए, आपने आपके जीवन भर में कितने एक्सरे स्कैन्स निकाले, कितने CT स्कैन्स निकाले, उसके साथ जो एसोसिएटेड एक रिपोर्ट आती है वो कितनी है, आपका खुद का. हालांकि आप अगर सबसे हेल्दी भी हो, आप जीवन में कभी बीमार भी ना पड़े हो, तभी भी आपके पास करीब करीब 100 से 200 MB का डेटा क्रिएटेड है. फर्ज कीजिए अगर जो बार बार बीमार पड़ते हैं उनका कितना बड़ा डेटा हो सकता है, उनका डेटा रिकॉर्ड कितना बड़ा हो सकता है, वो डेटा रिकॉर्ड आप कहाँ पे रखेंगे, कहाँ पे स्टोर करेंगे, उसको स्टोरेज के लिए कितना पानी लगेगा टू कूल दैट मशीन, दैट डेटा स्टोरेज कैपेसिटी इज डाउन। और अगर पानी आपके पास नहीं है, आपका ग्राउंड वाटर लेवल्स नीचे जा रहे हैं, आपके जो वाटर बॉडीज है अगर वो कंटामिनेटेड है, तो पूरा सिस्टम चरमरा जाएगा। हाल फिलहाल में हमने ये बात भी सुनी, खास करके जब कुछ कंट्रोवर्शियल चीज़ें जब डिस्कस होती है कि महाराष्ट्र से सब कुछ गुजरात में चला जा रहा है, एंड एज अ काउंटर ये भी बात आ जाती है कि नहीं, वैसा नहीं है। हम जब नवी मुंबई जो सी लिंक है जब बनेगा, उसको बनाते बनाते नवी मुंबई में बड़े डेटा सेंटर्स आने वाले हैं और आ भी रहे हैं, लेकिन उन डेटा सेंटर्स को कूल करने के लिए पानी कहाँ से आएगा? So we'll have to make sure that the water is available, and that's why sustainable environment becomes important. Studying the scenarios become important, and for that AR VR becomes important. And हमें एक इकोसिस्टम की तरह सोचना पड़ेगा। हम आज के ज़माने में सिलिकॉन वैली को एप करने की कोशिश करते हैं, उसके जैसा बनने की कोशिश करते हैं। हम भी यहाँ पे वैली में बैठे हैं, ये पुणे वैली है, ये मावड़ वैली है। क्या हम मावड़ वैली को, क्या हम लोनावड़ा, खंडारा को, नवी मुंबई को एक बड़े इनोवेशन इकोसिस्टम में क्या हम उसको कन्वर्ट कर सकते हैं? क्या हम छोटे छोटे यूनिट्स बना सकते हैं? क्या हम डिजिटल हेल्थ केयर सेक्टर के लिए एक इकोसिस्टम बना सकते हैं? और इकोसिस्टम बनाना मतलब कुछ ग्रुप्स बनाना या फिर कोई एसईजी बनाना या फिर एक बड़ा प्लॉट लेके वहाँ पे बिल्डिंगें बनाना, ऐसा नहीं है। आप जहाँ पे स्थित हो वहाँ से ही आप एक दूसरे को कैसे कोलैबोरेट करके फंडिंग पा सकते हैं, फंडिंग पाके आप क्या बदलाव ला सकते हैं। इन चीज़ों पे डिस्कस करने के लिए हमारे साथ अब है आशुतोष प्रचंड जी। एंड आशुतोष जी, मैं आपको निमंत्रण देता हूँ कि आपके पास समय है।
So thanks a lot RIS and SRGF for first of all letting us present our views and our experiences here in front of the a very good audience that is sitting here. Whatever had been being discussed here, one thing is very prevalent, and I want you to complete my sentence which I am going to say now. Necessity is the mother of, what is that? How many of us are thinking about invention in our daily lives? How many of you are thinking about innovating something which will probably benefit the immediate society that we are living in? Is it only that only when there is a necessity we have to invent? जेव्हा तहान लागेल तेव्हा विहीर खोदायला जाणं कितपत लोकांना योग्य वाटतं आहे, right? So for the invention or the innovation of penicillin, we had to look at a calamity like a world war. Is it only that while such kind of instances take place we have to innovate? Can't we think about inventive thinking in our daily lives? Can we not think about how are we thinking in our daily lives? How are we tackling our daily challenges or daily technological problems in a very comprehensive and structured manner, so that your inventive solutions are coming out very easily, right? And this is all about whatever is being talked, whatever the technologies that are getting developed by these my fellow panelists. They are trying to solve certain complex problems in life and in the industry, and complexity cannot be only addressed just by saying that I want to develop something which will probably in the future, maybe 10 years later, will benefit the society. If for that, first you have to address the complexity. Like, I am addressing a complex problem, and I have to find a structured way to address that complex problem in order to arrive at the solutions which are A, innovative, which are B, patentable or IP protectable, and C, how am I going to deploy those solutions in the society? What are my means and ways by which we can deploy those solutions in the society to benefit the society, right? There is a very simple fundamental formula when it comes to addressing the complexity. There is something called as SATDA model that everybody follows consciously and subconsciously. what is SATDA? SATDA is that when you sense something or when you see something and you have to act on it, you basically follow SATDA model. Now I'm going to tell you the each and every meaning of every letter that is there. So S is sense. You first sense what's happening around you, right? You acquire the knowledge of what is happening around you. So that is SA. T is when you think about how do you want to solve that particular situation or what kind of a decision that I have to take, right? D stands for decide. You decide something, whatever had been going through your mind, and then at the end you act upon it, right? Now the challenge in front of us that when we look at it from the technological advancements point of view, what is the time period that we're taking to, to complete this SATDA framework? If we are going to take 10 years to act, it's not going to solve the problem immediately. If you are going to probably 15 years, the technology shift will happen very quickly, and then your technology might not be relevant going ahead, right? So again, whatever had been the discussions that were happening in the prior by our panel members, one thing is very clear that they are basically trying to again reiterate the fact that you have data, you have to convert it into information. The information has to be converted into knowledge, and that's how you gain wisdom, right? So when I speak about innovation, or when I speak about creating inventive solutions and creating an intellectual property regime around your products and solutions, it is not only that, hey, I've got an invention, please help me file a patent, or hey, I've got an invention, please help me in probably commercializing it. At that very point, you have already crossed probably 1.5 years to arrive at a prototype stage, right? In that stage, you also have to think about what is going to be your ideal final results, what is going to be my final outcome, and how the market is going to look at it. Is it going to immediately accept it, or do I need to add certain more features? So innovation in a way is an iterative process, right? It cannot be like, then it becomes a linear process, then it's not an innovation. Only when you introduce complexity into what you're coming up with as a solution, it becomes innovative in nature. The more the complex nature of the technological problem, the more effective the solutions will come out. And that's the reason constraints are really, really important if you really want to innovate. I'll just give you a simple example. How many of you can think of a solution? Let's say if I tell you from tomorrow, जैसे मोदी जी ने declare किया था कि कल से 1000 की notes बंद हो जाएंगे. If I tell you from now onwards, you will not be able to use any toothbrush or any toothpaste. What is the immediate solution that comes to your mind? Any hand raises? Yeah. Correct. Neem Datun, right? That was known, right? And from there only, if you see the technological innovations, we are now using toothbrush. The neem stick was what? It was a toothbrush. So the point that gets highlighted here is that we are sitting on a very unique knowledge set. Only the problem is that the Western countries and the Western world has utilized that, sent it back to India, saying that abhi aapko ye products use karne hain, right? But we had been using it. So coming back to the, because we are gathered here to provide soft suggestions in policy. I noted down certain things which will probably be add value to the discussions that are going on. So the first thing is, because again we are talking about medical healthcare and digital healthcare infrastructure and innovation management here. Also, I think there's a point which relates to healthcare finance as well. So there are a couple of points that I noted down. The first thing is that why don't we create a public-private mechanisms to set up an ecosystem that will nurture only and only medtech and healthcare innovations. Why there is a need to do that? So if you're focused on only on one aim, I think most of the things will be addressed while doing so. There are a lot of institutions, there are a lot of mechanisms that have been developed who are trying to cater to large number of technologies at one go. And to do that, they're actually trying to incorporate complexity, as I was mentioning earlier. But in order to again acknowledge the complexity or address the complexity, you need a diverse set of people to be in that ecosystem. And if one of those or two of those people are not there, or one of those or two of those consulting companies are not around, then the entire the ecosystem may go for a toss. So we don't want that to happen at the juncture that India is right now, right? So it could be by means of providing a holistic view to the innovator who is wanting to develop something in the health tech or medtech industry, right? Why don't we create a culture, an innovation culture, wherein that person or that entity who is working in that field is exposed to all the aspects that may occur in future or in the journey of that startup, so that they are prevented from the future shock. At that stage, when they will be thrown with something कि ये regulatory hurdle अभी आएगा सामने, if that information is given to them prior to they are entering into that phase, don't you think the startup will be able to think in a very cohesive way? So that is one recommendation, that we need to create public-private modes of mechanisms by which we are able to address this very aspect of medtech innovations and healthcare innovations. The second aspect is that we need to take measures to flourish the domestic technology landscape. Again, the point that was highlighted in the earlier discussions was that how do we make sure that the technologies that are getting developed are not coming outside India and then getting market here? How do we do it vice versa? And for that, we need to have we need to inculcate inventive thinking amongst college-going students. So the topic of introduction of the curriculum, I'm just adding up to it, is that how do we make sure that the college-going students are taught about what is a medtech innovation, what is a healthcare innovation, what are the things that are, or what are the sets of people that are required. I've in my earlier work, I happened to work with a startup. Again, like Dr. Aniruddha Joshi here is not a Ayurveda specialist, but then he had been able to look at that aspect of innovation and then probably work around it, and then now he has a solution out there in the market, right? The very precise information that we can give to the students is that, hey, if you're wanting to work into this particular segment of technology or the technology domain, you need to have these many skill sets. You need to have understanding of the aspects that may occur in future, and that's the reason why I'm saying, or probably that's the way by which we can probably create a cohesive education ecosystem also. It is not that, because everybody who is a college-going student here will agree to the fact that whatever you have learned in that educational institution, when you go outside in the industry, some of it is only relevant, right? You have to constantly upskill yourself while you are on the job. May it be for promotions, may it be for your personal growth, may it be for your professional growth, but you have to find mechanisms by which you are upskilling yourself. So that is one recommendation, that can we bring in something which will enhance the quality of education and the the industry ready orientation of the students. Another thing is that we need to also create, as I was talking about, that you need to have diverse set of people with you. Can we not have a what do you say, a pool of professionals probably who are belonging to different sets of domains? Their domains might be different, but then right now I'm seeing that there are these panel members sitting in front of you. They have their own unique skill sets, and when they are combined together, some or the other novel thing may come out, right? So we have to look at how do we structure our team, and that's the essential part of an entrepreneur's life in order to select the team that they are going to have. Can't we inculcate that thought process in the students while we are telling them about entrepreneurship, while we are telling them about technology development, while we are telling them about intellectual property, we are telling them about innovation management. So that's one suggestion. And the last and the very last suggestion is that healthcare businesses in India has to go beyond trading. When it's not just that, you know, I'll get some devices or the technology from outside of India, make the product here, sell it here, and also send it back to its original place of its conception. So we have to also think about how do we gather or create some funds to be deployed into into technology development in a very effective manner. And that effective manner is not just saying that, oh, ye emerging field hai, to yahan pe we have to put in our money there. Will that emerging field be relevant in the coming years also has to be analyzed with the help of technology trend mapping and all sorts of competitor analysis and things like that. And because I come from intellectual property and innovation domain, we basically help the innovations to see the day of the light by way of either the patents that we have been able to generate, by way of technology transfer, by way of commercialization, by way of licensing those to certain big companies or smaller companies, and also by way of venture creation. So if we see some potential in the technology which really has a value in the market, we help them, or we at least advise them as to how should they go ahead about forming it into a startup or a company, right? So with that thought, I think there was one more data that I collected while I was studying about this entire topic. In India, because the topic again here is about healthcare finance as well. In India, do you know how many of we spend on healthcare, and in what pattern do we spend? If let's say there's some medical emergency happening in the family, the very resource that we look into is our personal savings, right? So there is an interesting statistics and which tells us about that the healthcare, and this is by the way the official line that I'm quoting here from the database of India, that the health insurance penetration in India is very low, and the breakup of how Indians pay for healthcare expenses is 82% personal sources such as savings, loans, money taken from friends and family and other sources. 12% of those are government funded, right? 4% are through insurance and 2% are employee insurance, right? So again, the point of highlight here is that the healthcare insurance has not been penetrated in India the way it has to be penetrated, and then that's how we are now saying that, oh, the healthcare devices or the medical treatment is not affordable. It has to we have to make it affordable. But that is completely absolutely true. But then in parallel, we also have to look at the insurance penetration in India also. If we compare that to in US, they are not really tapping into their personal finances. And the percentage of that is very low. So I think about 34 to 40% only are going for personal finances when it comes to treating themselves in a hospital for certain ailment that they are going through, right? So I thought of highlighting this because healthcare finance is also a major issue that needs to be addressed. So one more suggestions on those lines is that what can we do to ensure that everybody at the grassroots level is made aware about health insurances and healthcare finances as well. So these are the points that I wanted to sum up today. Thanks again. Thank you, RIS and everybody who is present here. Thanks a lot. Thank you.
आशुतोष जी ने जब हेल्थ केयर इंश्योरेंस की बात की तब हमें उसको ऐसे नज़रिए से देखना है कि अगर हेल्थ केयर सेक्टर में आपको इनोवेशंस चाहिए उस इनोवेशंस को फाइनेंस करने के लिए एक तरीका होना होगा। और अगर आप आपके सेविंग्स के थ्रू जा रहे हैं या तो फिर आप आपकी कैश बर्न करके आप आपका जो मेडिकल इंटरवेंशन है उसको फाइनेंस कर रहे हैं, तो वो जो कैश बेस्ड मेडिकल इंटरवेंशंस है वो R&D तक नहीं पहुंचेंगे, वो कभी नहीं पहुंचेंगे। अगर उसको R&D तक पहुंचवाना है देन यू विल हैव टू फॉर्मलाइज द एंटायर इंश्योरेंस प्रोसेसेस एंड देन फिर इंश्योरेंस फॉर आयुर्वेद एंड वो सब कुछ आ जाएगा। सो हेल्थ केयर इनोवेशन, डिजिटल हेल्थ इंफ्रा की बात तब तक खोखली है जब तक इंश्योरेंस पेनिट्रेशन नहीं होगा, हेल्थ केयर इंश्योरेंस का, मेडिक्लेम इंश्योरेंस का। सो वील हैव टू एक्ट ऑन दोज लाइन्स। फाइनेंस एक बहुत बड़ा मुद्दा है और सिंस वी आर राइट नाउ समवेयर अराउंड 3 ट्रिलियन $3.5 ट्रिलियन इकोनॉमी, जैसे हम 5 ट्रिलियन 10 ट्रिलियन की ओर बढ़ेंगे, जो जनधन आधार जो जैम ट्रिनिटी है इसको हमें इस्तेमाल करके फाइनेंसिंग को सुधारना होगा। एंड परहैप्स आरोग्य सेतु and Digital India Vision for Ayushman Bharat is perhaps the way to go. Once you formalize, once you digitize the entire process, once your health card gets connected with your Aadhaar card, and then that connected with your bank accounts, so this entire system will then sort of kick off, hopefully, R&D in India, especially for the medical sector. तब तक we'll have to beg before venture capital firms and ask them for money. और venture capital firms भी खुद से पैसा नहीं लाते। venture capital firms भी sovereign wealth fund के पास जाएंगे, they'll go to institutional investors, उनको बोलेंगे कि आप हमें 500 करोड़ का टिकट साइज दीजिए, हम इतने इतने आपको कंपनियां लाके देंगे। So ये टिकट साइज क्रिएट करने के लिए यू नीड इंश्योरेंसेस, यू नीड दोज फाइनेंशियल सिस्टम्स। एक सिंपल सा उदाहरण देता हूँ और ये थोड़ा सा डाइवर्जनरी उदाहरण है। भारत में बड़े मात्रा में इंफ्रास्ट्रक्चर बन रहा है। आप देख रहे हैं एक्सप्रेस हाईवेज, एक्सप्रेसवेज, महाराष्ट्र में समृद्धि अभी खुला है, अभी शक्तिपीठ एक्सप्रेसवे खुलेगा, so which will start from Vidarbha and that will go through southern districts of Maharashtra towards Goa, Kolhapur district तक। तो ये सबको फाइनेंस करने के लिए we've started something known as the नेशनल इंफ्रास्ट्रक्चर पाइपलाइन, और ये नेशनल इंफ्रास्ट्रक्चर पाइपलाइन को भारत सरकार ने करीबन $1 ट्रिलियन की इन्वेस्टमेंट साइज रखी है। इट्स अ मैसिव इन्वेस्टमेंट। इसमें एक्सप्रेसवे भी आ गए, इसमें आपके पोर्ट्स भी आ गए, इसमें आपके हाई स्पीड रेलवे भी आ गई और ये सब कुछ आ गया। वैसे ही पाइपलाइन हमें हेल्थ केयर सेक्टर के लिए चाहिए, क्योंकि दैट इज ऑल्सो अ क्रूशियल नेशनल एसेट। और कोविड ने हमें वापस में रीइटरेट कराऊं कि हमने बताया है कि नेशनल सिक्योरिटी इज़ नॉट जस्ट वेपन सिस्टम्स, नेशनल सिक्योरिटी इज़ नॉट जस्ट योर एयरफोर्स, नेवी एंड आर्मी, नेशनल सिक्योरिटी इज़ ऑल्सो योर गुड हेल्थ। अगर आपका स्वास्थ्य अच्छा नहीं है, योर नेशनल सिक्योरिटी इज़ कॉम्प्रोमाइज है। सो हेल्थ सिक्योरिटी, supply of good food to you is food security, supply of nutritious food to you is nutrition security। तो हमने जब इसकी बात की, मेंटल हेल्थ की बात की, मेंटल हेल्थ के रिलेटेड जितने भी साइंटिफिक पेपर्स आए हैं उसमें यही पाया गया है कि वन ऑफ द कॉजल फैक्टर्स इज ट्रेस मिनरल इन योर डाइट। अगर आपके डाइट में ट्रेस मिनरल्स नहीं है then you are more susceptible to mental health issues। तो न्यूट्रिशन सिक्योरिटी की बात आती है, और अगर ये तीनों चीज़ें अगर कॉम्प्रोमाइज है, हेल्थ सिक्योरिटी, फूड सिक्योरिटी, न्यूट्रिशन सिक्योरिटी, then you are at the mercy of the global pharma cartels। So to counter that, we have to take this topic very seriously। It is not just about health, it has national security paradigm to it, it has economic paradigm to it, it has innovation paradigm to it। एंड अगर आपको विश्व गुरु बनना है तो आपको आपके ट्रेडिशनल नॉलेज में झांक के जो कुछ भी अच्छी प्रैक्टिसेस उसको निकालना पड़ेगा, उसको कंटेम्प्रेरी बनाना पड़ेगा। यू विल हैव टू मेक इट कंटेम्प्रेरी। इट्स नॉट दैट you will have to work with the 1st century or 2nd century ways or the BC era ways before Christ। ऐसा नहीं है, आपको उसको कंटेम्प्रेरी बनाना पड़ेगा, आयुर्वेद को कंटेम्प्रेरी बनाना पड़ेगा एंड स्टार्ट मेकिंग गुड यूज ऑफ इट. सो विद दैट वी क्लोज द कन्वर्सेशन अमॉन्ग्स्ट अस एंड नाउ विल ओपन इट अप फॉर द ऑडियंस. आपके मन में जो कुछ भी सवाल है आप मुझे पूछिए, हाथ ऊपर कीजिए, पूछिए, एंड देन विल पास इट ऑन टू the experts on the podium. Anybody? कुणाला हात वर करायचा आहे? थांबा, चालू नाही.
नमस्कार, गुड इव्हनिंग. मायसेल्फ चैतन्यजी म्हटले की डॉक्टरांना बोलवलं नाही आहे, पण कर्मधर्म सहयोगाने मी आयुर्वेदाचार्य आहे आणि मानसशास्त्रज्ञ आहे. आय एम आयुर्वेदाचार्य अँड क्लिनिकल सायकोलॉजिस्ट. आय हॅव माय ओन क्लिनिक कॉल्ड एज मनाची व्यायामशाळा. मेंटल हेल्थ इज माय की अँड आय यूज वर्ड्स ॲज अ ट्रीटमेंट because problems are created because of words. Solution should be words, and that is what my perspective is. And we are talking about lot many things of prevention. Not prevention, actually recovery, मेडिसिन के बारे में बात कर रहे हैं, लेकिन वो हो ही लाइक आयुर्वेदा से स्वस्थस्य स्वास्थ्य रक्षणम. एंड फॉर दैट माय सजेशन, बिकॉज यू आर ऑल वेरी मच लर्नड पैनल, I am not that technically and digitally upgraded and sound, but my suggestion, I take this an opportunity for well-being. I had written a letter to Modi ji and Ayush Mantralaya. Ayurveda speaks of Panchakarma, that is detoxification, and Central give funds on treating the patient, but not for being wealthy. So I had written the letter, but it is still pending. With this platform I would like to take this note. If राजाश्रय आयुर्वेद को मिलता है, सेंट्रल गवर्नमेंट, स्टेट गवर्नमेंट एम्प्लॉयज साल में एक बार पंचकर्म करवाते हैं, तो हेल्थ अच्छी होनी है. डिटॉक्सिफिकेशन इज द की. इफ दैट इज बीन मेड अवेयर, दैट कैन बी थॉट ऑफ. सेकेंड, वी आर टॉकिंग ऑफ यूथ एंड स्पोर्ट्स. उसके लिए मैंने बहुत सारे लोगों को खत लिखे हैं. अमित जी को लिखा है, भागवत जी को लिखा है, देवेंद्र जी से मुलाकात की है. 1000 सूर्य नमस्कार बच्चा डालता है, उसको 5% मार्क बढ़ा के दे दो यूथ में. सर, आज के तारीख में बच्चे लोगों के पेरेंट्स पूछते नहीं एक्सरसाइज किए कि नहीं किए, वो पूछते हैं खाना खाया क्या, कॉलेज गया था क्या, पढ़ाई की क्या. एक्सरसाइज इज आउट ऑफ सिलेबस. कैसी आएगी इम्यूनिटी? लेट अस टॉक ऑफ इम्यूनिटी ऑल्सो. ऑन टू डेवलप इम्यूनिटी, आई थिंक दिस अवेयरनेस, अगर ये हम कोप अप करवा लेते हैं तो ज़्यादा अच्छा होगा. एंड माय रिक्वेस्ट टू अनिरुद्ध जी कि जैसे नाड़ी तरंगिनी है, वैसे एसआरटी के बारे में, सत्वरजतम के बारे में कुछ हम कर सकते हैं क्या? क्योंकि मेंटल हेल्थ का रूट कॉज है सत्व का कम होना. तो सत्व के लिए क्या कर सकते हैं, और उसके अवेयरनेस के लिए अगर कुछ कर सकते हैं तो बहुत अच्छा होगा. क्योंकि गुड मेंटल हेल्थ इज एश्योर्ड सक्सेस. दैट इज माय टैगलाइन ऑफ माय क्लिनिक, एंड दिस इज माय सजेशन. आई टेक दिस अपॉर्चुनिटी ऑन दिस प्लेटफॉर्म. थैंक यू सो मच.
थैंक यू सर. आपने ये बात कही कि गट हेल्थ के बारे में पॉइंट आउट किया है कि गट हेल्थ का सही होना कई सारे बीमारियों का निवारण है. एंड दैट्स अ वेरी गुड पॉइंट. वेल टेकन. इट्स रिकॉर्डेड एंड परहैप्स सम ऑफ अस विल टेक इट अप विथ यू इन द नियर फ्यूचर. थैंक यू सो मच. और कोई मैडम वहाँ पे?
Okay, good afternoon everyone. I am Aishwarya Kolle from Modern College of Engineering and I am a management student. We are all working on various of the issues of health and well-being, and we all are working solving the root causes of all. But don't you all think that it's all in mind? Even quantum healing and even subconscious programming also says that. Also we have witnessed in the corona period that 90% of the diseases are caused from our minds, and it's fear which is all governing us, and which is controlling our physical health also. So can we have an augmented reality mixed with the concepts of Ayurveda, and it can be instilled in our schooling also, so that we can create a culture of being healthy. It means there should no it doesn't mean that there should not be a concept of disease, but every child must know what health is. Or for example, if when you get a fever, we all know that the basic cause of the fever is when your body gets attacked by microbes from external environment, and your immune cells are fighting it, so it is a basic cause of fever. But we have a culture of take crocin, take P500. We all don't accept that we don't need medicines, we need ourselves. Self-healing is the only solution, because it all starts from within. So it's my recommendation and suggestion that augmented reality or a subconscious programming should be created at a very basic level. It should be instilled in curriculum at the very beginning of the schooling, so that we can create a better culture of good health and well-being.
Thank you. Do you want anybody to respond on this?
Ma'am, I want Dr. Aishwarya to answer my points.
Hi, Aishwarya.
Hello, ma'am.
So that's a really, really absolutely good point, and I completely agree with you. So most of our health is controlled by our mind.
Yes.
You're absolutely right. We have, on a subconscious level, we are, if we think that we are healthy, then we are healthy. So definitely this is something that we can surely consider creating in a augmented reality or a virtual reality environment. In fact, what you're speaking about is more related to the VR environment, where you can actually simulate these conditions. You can train your mind to think in a certain way, and that's something that we can definitely collaborate with experts in Ayurveda and medicine to do these. So thank you for putting forth this important point.
Thank you, ma'am.
So hi, this is Nivedita Egbote. So I'm a faculty with management. I was pursuing my faculty development program from IIM Ahmedabad, and there was this case study known as GE. Everybody is aware of General Electric as a company. What happened was, when GE wanted to come into India, they understood that there is a bottom-up pyramid that is huge here. If you consider a population of India, so there is a huge bottom that is available. That means the lower middle class economically. That's what I'm trying to say. What happened was, when they wanted to penetrate, they understood that even the hospitals and the rural areas couldn't afford their devices, as in the ECG machines also. And then they started looking at the disruptive technology, so that they wanted to have an instrument or an ECG machine which is not existent, but they wanted to prepare it for the underdeveloped countries. So that they went into and started thinking that 100 rupees mein ECG machine banaya kya. This is a real fact. Not exactly 100, but then 1,000 or 2,000. So they wanted to manufacture cheap, but then quality-wise better instrumentations. Now I am now okay with it, but what will happen when you want to develop these kind of cheap machineries with plastic and everything, and you want them to manufacture at a massive level? How will you dump it? What will happen to the environment? And what will happen? That is okay that गरीब लोगों को treatment मिल रहा है, गरीब लोगों का ECG निकल रहा है, but what will happen when this will go as a waste? What will happen to the waste management of it? So that is my, I'm still not able to find the solution about it. And then, like you said, talked about One Health. What will happen when we want to dump the ECG machine and buy a new one? So that is my question. I don't know, it is not a suggestion.
Anybody wants to answer? You?
So precisely where you're talking about is coming up with contradictions, and only when there is a contradiction you come up with an invention. Okay, so very valid point that there is plastic, now we want to take care of the wastage of the plastic. Immediately, somebody with a mindset of inventive thinking will come and say that, hey, I'm making some biodegradable material, right? And probably that company, or let's say you are, for instance, you are running the company and then you are making plastic. Instantaneously, you can have a collaborative opportunity with that person saying that, let's collaborate, make something which is, biodegradable. I know you are working with biodegradable materials. I am working on this device. Let's make our device into your material. So this is very paper napkin thought, but then there are materials available right now which can easily replace plastic. So probably the shortest answers to that would be to switch to those biodegradable materials and then look at saving the environment in general.
Yeah, another point that I would like to add to that is we must think of circular economy while we think of developing any sort of electronics well beforehand. So there should be a strategy in place that you have a head count of number of units that you are manufacturing and the end of life cycle strategy for it. That what happens at the end of its usage, where does it go, and where should the components eventually go. So if the body is to go, let's say, to a plastic manufacturer or recycler, then it should go to the recycler. The electronic components, if it has to go to electronics recycling company, then it should go there. So an end of life cycle strategy needs to be put in place, and this is not just for medical devices but also any consumer electronics, mobile phones as well. So hardly a Vijay Sales or a Chroma has some of them have units placed to go and just put down your dump your used electronics or old electronics, but that should come into practice in a much larger manner. And that also again sort of connects with the circular economy aspects of sewage water. That's also a circular system. It's a water system that needs to be contained. So we'll have to circularize various aspects of our activities or our production. Sewage can be one production, or is one production. We cannot shy away from it. So are electronics, and sound strategy is needed. And that's why One Health, as you rightly pointed out, that environmental health is very much intricately and intimately linked to human health.
So I was actually going to mention the same point Professor Giri just mentioned, the circularity. So in product management domain, there is this concept called cradle to cradle product design, which is basically when you start designing the product, you look at the end of life cycle before you actually start building the product. So how the product is going to end its life, and as Professor Giri rightly mentioned, the circularity aspect within it is very important. Right now, most of our products, what we see, are under the domain or under the virtue of cradle to grave. So designed and then you throw away. But how we can close the loop, make it more circular? In fact, here the traditional wisdom that we have had for so many years about repair. So we manufacture pumps, and we see this very often, that the products that are coming from abroad, those are not designed for repair. So a classic case we have experienced wherein a pump that was supposed to be installed in a wastewater treatment plant, due to some problems, and it happens that the motor burnt. Now the operator didn't know what to do because they were not designed to repair. So what we do here is we know that repairing is in our DNA, and repairing is a must. So repairing itself, so ease, how not just cradle to cradle, but how to have ease of repair of these products is also a kind of a circularity aspect that we need to look at. So just adding to what you just mentioned, this is a very critical aspect. Thank you.
Just to comment, because I am into medical devices. So the biohazard or the bio waste which is generated because of the used medical devices, because you started a talk with the pretext of medical devices, the plastic. So that is being handled very well, as in there is a very good policy and very good SOPs that they follow in how to get rid of this bio waste, and ultimately whatever is left is probably getting reused, recycled and reduced. But what brings to my notice is when it comes to plastics, how there was a time when there were polythene bags in everybody's hands, and then a rule came and the malls started charging extra for the bags. So I think that kind of a policy or that kind of a rule should come for using bottled water. We very easily pick up bottled water and we drink and we just we keep the bottles here and there. That is probably a very highly ignored plastic waste that we are generating while we are talking about sustainability. So I think there has to be some strict policy, or I would say charity begins at home. We have to consciously stop using plastic bottles to avoid generation of plastic waste. Of course, there is in plastic bottles reduce, reuse and recycle is there, but still if we can reduce the use of these plastic bottles, it would be good.
Yeah, I noticed you saw the bottles lying over there.
Absolutely.
Okay. Farmers.
No, I just gave a reference of NCL, the work that they were doing during the fourth wastewater surveillance. So if I understood your point correctly, is it about the usage of, let's say, fertilizers in agriculture, which is creating the problem of runoffs? It's a very valid and a very critical concern, and especially about the sugar industry that you mentioned. This is typically the spent wash coming out of distilleries, which is extremely polluted effluent. And in terms of the water practitioners, they call it high strength wastewater, extremely highly polluted. The Central Pollution Control Board has, in fact, although there are lax enforcement in some of the other areas, here of late they have been very strict. But still, there is a long way to go. And as you rightly pointed out, the absorption of the salts that are coming in the spent wash, in the waste, in the groundwater, which eventually finds its way into the farm through the aquifers, that is creating a lot of infertility in the soils. So that's a very valid concern that you are highlighting. So right now, सो सर परत त्याच्यामध्ये हाच विषय की टेक्नॉलॉजी सगळ्या उपलब्ध आहेत आपल्याकडे, हा अंमलबजावणीचा विषय आहे. कारण खूप टेक्नॉलॉजी, मल्टिपल इफेक्ट डिस्टिलेशन, मल्टी इफेक्ट इव्हॅपोरेशन, नाही पण आहे, म्हणजे दॅट इज व्हॉट इज नीडेड अल्टिमेटली. अनफॉर्च्युनेटली इट इज कॉस्टली बिकॉज द काइंड ऑफ पोल्युशन दॅट इज देअर इन द वॉटर, त्याच्यामुळे त्याचा खर्च जास्त वाढतोच. पण त्याची यंत्रणा उपलब्ध आहेत आपल्याकडे. नाव हाऊ टू एन्श्योर दॅट दोज आर एन्फोर्स्ड अँड इम्प्लिमेंटेड करेक्टली अँड युज्ड मोर इम्पॉर्टंटली, आय थिंक इट्स अ पार्ट ऑफ हो. बरोबर तुमचं, म्हणजे तुम्ही जे म्हणते ते अगदी बरोबर आहे. ह्या क्लासकी प्रॉब्लेम आहे, ते पोल्युशन कंट्रोल बोर्डचे दृष्टीआड सृष्टी म्हणतात तसं ते करून टाकतं. काही त्यांना they are not bothered much about the after effects of it. So more than technology, I would say somehow we need to, there should be some financial incentive built in through policy measures की हे तुम्ही बाहेर टाकलं तर, नाही टाकलं तर तुम्हाला काहीतरी इन्सेंटिव्ह, किंवा if there are technologies which can be made available to reuse or recycle that heavy salt that remains after the evaporation system, that could be one measure. So या आय मीन ते टेक्नॉलॉजी आले, पण ते खरं तर अंमलबजावणी नीट व्हायला पाहिजे, हाच त्यातला महत्त्वाचा मुद्दा आहे.
एक there is one possible use of salts which is now emerging, Now, it's still far away from getting incentivized, but that is using that salt for creating salt ion batteries. That is still far away, but I think institutions like CPC or SRGF can take up that kind of call and start disseminating the idea, perhaps, because reducing the salts is a major issue throughout the country. It's also there in Haryana, it's also there in southern districts of Punjab, and it's also there in certain areas of Bengal, where the water table is high because of the rivers there. No, the farmer is not to be blamed. Yeah.
Hybrid things have to come to more production. You have to use fertilizers. Yes, the salts cannot be broken. They are there in the soil, either in the water or somewhere. You cannot have any alternative.
So how to ensure they don't get there in the first place? That is the critical part.
And even if the salts are created, maybe there could be ways of chemical remediation or biochemical remediation. Yeah. Standard, no?
Soil conservation is a very well-known science. There are many people who are working. It's a subject in itself.
Yeah, but
soil conservation. Wherein they study what are the different components in soil which needs to be maintained, how to get rid of hazardous chemicals that are there in soil. It's a very standard subject. I'm sure we'll have specialists or subject experts in soil conservation around us only. Pretty sure about it.
Else's land. Yeah. I think the scientific solutions will have to sort of adapt to the policy needs or adapt to the grassroots needs of the end users here.
Or maybe find out a plantation which can thrive in those kind of soils. Right now we are just having. Correct.
Anybody there? You have a mic? Yes, the one with the mic.
My name is Rishikesh Boga and I am from Modern College. Sir, I would like to add some points.
Rishikesh, which discipline are you in?
Yes, management discipline.
Management, okay.
Yes. Sir, I would like to add a point to this discussion. While we are talking about well-being and sports for the youth, okay, so most of the youth are now converting to the virtual games, whereas Valorant and that all. But why don't we think about their mental health also? As they are going to the virtual games, they are restricting their areas. They won't eat a lot, or they don't even think about their family members, and they stick to that whatever is going on is only in the games. They don't think about their friends, families and all, and that is how it's affecting to their mental health as well as physical health. Can we bring up some ideas which will be included medical health well as surrounding and their sports? Can we have something on that thing?
Achha,
any ideas for this type of discussion?
Do you have any ideas?
Yeah,
because this is not just one-way conversation. The entire exercise, Ali, if I'm not wrong, is to get ideas from the audiences as well.
I was about to ask the same question that Professor Giri asked. Do you have any ideas which can be implemented? That's the whole takeaway message here throughout these discussions, that what and all the youth can do to address these problems. And the very important and critical point that you highlighted is that youth is engrossed into mobile phones, maybe playing games or social media and anything of that sort. Naturally, this is an important problem. But if you have any like solutions that on top of your mind, if you can suggest, just quickly, if you can think about something, maybe we can come back to.
Can be as simple as anything. Just speak up.
The solution simply as whereas ISL and IPL goes on, people think and just watch it for a while. Just अभी ऐसा होता है कि IPL चल रहा है तो बस 2 महीने देखते तो उसके बाद कुछ होता नहीं है क्रिकेट में. But as
हो रहा है ना, टेस्ट मैच हो रहा है
ना? नहीं सर, जितना IPL देखते हैं उतने लोग टेस्ट मैच नहीं देखते हैं. तो वो जो क्रेज है IPL का वो बस 2 महीने तक ही होता है. तो आफ्टर दैट कि बाकी जो 10 महीने हैं तो उसमें यूथ वापस से वही वर्चुअल गेम्स में आ जाता है. तो ठीक है, तो फिर आई वुड थिंक दैट कि मतलब ऐसे कुछ करते हैं जिसमें ग्राफिक्स रिलेटेड हो बट द गेम वुड बी फिजिकली.
हाँ, You have to play the sport eventually.
on the spot.
The rest of the 8 months.
जो कुछ भी होगा वो ground पे होगा, but the result would be graphically.
Absolutely. So this is where actually augmented reality comes into picture. Anyway, you are using mobile phones. Anyway, you're using a lot of technology. Why not leverage that in your interest and have some virtual games that you can project in your field of view, in your environment, and get educated from them, get awareness about the, like you said, the health effects or the importance of nutrition or whatever, and then create these kind of games. So absolutely, this is something that we can definitely create.
Sir, and
I'll give you an idea.
Sir, we can collaborate with some brands also. Even Adidas has launched that.
So, Rishikesh, for your individual sport that you would like to play, what we can do is maybe imagine a scenario where you are all alone, you don't have anybody to play with. You put on your virtual glasses,
VR box, and you can play it.
And then you can play. Then you can imagine, let's say, Ashish Nehra bowling at you or Zahir Khan bowling at you. And
Sir,
you can imagine yourself as a batsman or something.
Sir, whereas BGMI is as affordable to as middle class family, that VR box is not affordable to everyone.
Right.
That's the main reason why people are switching over.
देखो इसीलिए मैं कह रहा हूँ कि डिजिटल जो हेल्थ इकोसिस्टम है वो यहाँ पे बनना चाहिए so that the devices are manufactured here. Then once you manufacture it here in large volumes, the price will come down and then it will become affordable. But even then, you should meet your friends and play with them.
Exactly.
Yes, sir. Thank you.
We don't. तिकडे मागचं.
नमस्ते, मैं नीतीश तिवारी स्कूल ऑफ फार्मेसी MIT से. मेरा क्वेश्चन है सूर्या मैम के लिए. जैसे कि उन्होंने बोला कि मैकेनिज़्म बेस्ड स्टडीज़ होना चाहिए, जैसे कि ह्यूमन एनाटॉमी पढ़ाते हैं, बट एक्चुअल मैम फैक्ट ये है कि जितने भी यूनिवर्सिटीज़ में देखें तो ऐसा कहीं है नहीं अभी. और ऐसा ये भी नहीं है क्योंकि जो टीचर ऑलरेडी ट्रेंड है तो वो भी उस मैकेनिज़्म से उतने अवेयर नहीं है कि वो एनिमेशंस को दिखा सकते हैं. और जब तक अगर मैं बात करता हूँ एंटीबायोटिक्स है, एंटीडोट्स है, जितने भी हैं, तो जब तक वो मैकेनिज्म पता नहीं चलेगा बाईपास क्या है, कैसे है, क्या इफेक्ट्स है, तो इनोवेशन, जैसे कि आशुतोष सर ने मेंशन किया कि इनोवेशन, तो इनोवेशन फर्स्ट वहीं से आ पाएगा जबकि मैकेनिज्म कोई समझेगा. तो ये बहुत ही बड़ी चैलेंज है हमारे पास. अभी हम इस एज एरा में आ गए जहाँ डिजिटल की हम बात करें, बट मैक्सिमम हम इंस्टीट्यूट को देखें या यूनिवर्सिटीज़ को देखें तो वहाँ ये फैसिलिटीज़ नहीं है. और दूसरा जोशी सर से मेरा है कि जो कि आयुर्वेदा इंजीनियरिंग से जब आप आयुर्वेदा के फील्ड में गए तो बहुत सारे आपने स्टडीज़ किया होगा, और स्टिल मॉडर्न जो अभी हेल्थ साइंस फील्ड है उतना भी नहीं पहुंच पाया है, चाहे जितनी हम बातें कर ले डेवलपमेंट की. बट 3 मैकेनिज्म से जैसे कि हम डिजीज़ को कंसीडर करते थे आयुर्वेदा में, पीता दोसा जो भी था, बट स्टिल हमें वो एप्लीकेशन बेस्ड स्टडी नहीं है. जैसे कि कोविड की मैं बात करूँ तो सबसे ज़्यादा पॉपुलेशन इंडिया में है, अभी सबसे ज़्यादा डेथ होना चाहिए एक्चुअली, बट नहीं हुआ क्योंकि फाइटोकेमिस्ट्री जो भी है पहले से हमारे यहाँ जैसे वायल है उसमें बहुत सारे हम मसाले यूज़ करते हैं, उसके फाइटोकेमिस्ट्री स्मेल आते हैं. और बहुत सारी ऐसी कंपनियाँ आई जो कि ड्रॉप्स बनाए, नेजल ड्रॉप्स, और उनकी इफेक्ट उतने नहीं थे बट फिर भी सेलिंग हुई. कि कैसे भी लाइफ को बचाया जा सकता है, जब पहला चैलेंज था. उसके ऊपर केसेस भी, बहुत कंट्रोवर्सीज भी हुई, बट एक्चुअल में ऐसी कोई कॉलेज या यूनिवर्सिटी नहीं है जो इंटर्नशिप देती हो उस चीज़ को लेके. क्योंकि अभी हम जो भी आयुर्वेदा एंशिएंट की बात करें तो पहला चैलेंज वर्ल्ड तभी एक्सेप्ट करेगा जब हम उसको प्रूव कर पाएंगे. सो यूनिवर्सिटीज़ और कॉलेज में वो फैसिलिटीज़ नहीं है, तो ये चैलेंज को हम कैसे ओवरकम कर पाएंगे. थैंक यू.
Okay. So yeah, thanks for the question. So this is exactly where organizations as the one that I'm working, Ethos Digital, this is where they come into picture. Because हमारे यहाँ पे ऐसे subject matter experts हैं जो ये जो गैप जो है ट्रेडिंग में और ये इमर्सिव टेक्नोलॉजीज दिखाने में, वो हम बेसिकली उसको ब्रिज कर सकते हैं. सो वी कैन क्रिएट दोज एक्सपीरियंसेस एंड वी कैन एक्चुअली ट्रेन द टीचर्स और एनीबडी हु इज ट्राइंग टू अडॉप्ट दोज टेक्नोलॉजीज एंड वी कैन शो देम हम ये टेक्नोलॉजीज कैसे यूज़ कर सकते हैं. सो एब्सोल्युटली ये जो गैप आप जिसके बारे में बात कर रहे हो, तो एक तो डेफिनेटली विल नीड टू एजुकेट your institutions for adopting these technologies, and this is basically where we can assist and we can come into the picture for that.
Thank you.
अपनी मैं थोड़ा सा रिफ्रेश करूंगा क्वेश्चन को कि कैसे आयुर्वेद को कल्चर में लाया जाए या हर घर आयुर्वेद जैसे हम बोलते हैं। अभी हमने देखा कि सर ने भी बात की, सूर्य नमस्कार की बात की या साफ मन होने की बात की, गट हेल्थ के बारे में बात की। सो एक्चुअली so far we have I think exported yoga to the world, and let's assume that every 10th person in the Western world is now doing yoga, and very soon every that person is going to, the natural transition is going to be Ayurveda. So that person is going to adopt Ayurveda, but that person is going to adopt Ayurveda only if it is proven in the Western language, which is the language of devices, numbers, statistics, reports, comparison, and so on. So that is needed. One. Two, थोड़ा टाइम लगता है ये सबको के. So for example, now we are using ECG everywhere. First ECG कब निकला? Maybe 250 years ago. फिर 150 साल पहले, 100 साल पहले, few institutes came together and they actually studied all the ECGs together. फिर 50 साल के बाद कुछ समझा कि उसमें कुछ होता है, and now we are, we are using it almost at every hospital. Now ECG is on our watch and so on. So similarly, there is a very huge need that technical institutions, medical institutions, allopathic institutions, Ayurveda colleges, everyone come together. Lots of funding is available to make sure that lots of data is gathered. It is studied well. People who believe in Ayurveda, people who don't believe in Ayurveda, they come together and study and get the real crux out of it, and then we solve it. So exactly 10 days ago, our team was in Geneva. WHO में नया marketplace खुला. From India only 12 solutions went, and as a medical device एक ही device गया था जो हमारा device था. Okay, so the world is open for new ideas, new innovations. हमने अपने Honorable Health Minister मनसुख जी का नाड़ी almost 25 different countries के ambassadors के नाड़ी, and they were amazed. ये amazed ठीक है, but this amazed should get converted into actual technology, money coming to Bharat. By 2030 we are going to use lots of wearables. Google Glass आएगा, watch में 3-4, belt में sensor होगा, shoe में sensor होगा. As someone was saying, Bharat किधर है? Where is the innovation from Bharat? I think this particular sensor, this Nadi sensor, could be one of the technology sensors which can be on every, so that should be the aim. That is my aim, that billions of people, at least to start with, millions of people are wearing the Nadi sensor and going further. थोड़ा सा हम लोग हल्के में ले रहे हैं वेलबींग को, आयुर्वेद को एंड सो ऑन. इतना हल्के, मतलब इट्स अ वेरी सीरियस इशू एंड वी हैव टू मेक श्योर दैट of course it will take time. We say that today's innovation becomes tomorrow's culture and so on, that usko time hai. I know that it will take a couple of decades to actually adopt Ayurveda or philosophies of Ayurveda. It need not be actual Ayurveda, but it will take its own time. But we have to make sure that हम लोग अभी बोल रहे हैं कि योगा हम स्कूल में सिखाएंगे. हम लोग बोल रहे हैं it has already started. People are adopting it. So I don't know whether I answered your question because you had answer in your question only. But मैं आपण maximum लोकांचं बघतोय पुणेकरांकडे प्रश्न घेऊन उत्तर असतात. So we saw that we got more suggestions than questions. But yes, what you said is absolutely right, and it has to be adopted at all grassroots. So the technology which we are developing, we are making sure that you will get your report card at 10 rupees. Okay, that is what our aim is. There are 8 lakh healthcare centers across India. The scanning at all those centers for variety of diseases, variety of problems, 10 rupee a report. So, and maybe its outcome could be you do ECG report or you do this specific report, or So it may not be the final report. We are still working on it, but it has to be affordable, it has to be sustainable, and that is the essential requirement from WHO, that affordable and accessible solution. So that is precisely is the need of the hour, and of course when all hands will join together, I think we'll come up with the technology and we'll export that technology. I mean, that is the most important aspect.
Okay, time for last 3 questions. We have already identified. Yes, you go ahead quickly.
Hello.
Mike.
Hello. Myself Sudarshan Saraswat. I'm from Modern College of Engineering, MCA. My question is for Aishwarya ma'am. Ma'am, how you suggested the AR VR for rehab, right? So how will we prevent people getting addicted to the short form content we see on the AR VR technologies, like the reels, like YouTube shorts? The short form content always releases the dopamine, it gets you hooked, and once you're hooked, you just waste time, you procrastinate, you do everything except get things done. What can be done to prevent it?
If I can answer on her behalf, what she meant was prescription based AR VR for mental health.
Yeah.
So it is prescribed by the doctors, it's not on YouTube.
It's a device-based prescription from the doctor. So of course you won't get hooked to it. You would rather benefit from it, because it won't be like Instagram. You're continuously on your phone and scrolling. Yeah.
How will we know that? How will the doctors know that this is the right amount or this is not? Because there are patients abusing the medicines as well, the prescribed medicines.
Agree.
That's the question.
Yeah.
That's a valid point.
Absolutely valid point. And this is where the concept of digital twins can come here. Because let's say I simulate the human body and I know that it is suffering from a certain condition. I can conduct experiments. I can do that in a controlled environment. I can decide the dosage, the amount of time that they should be watching this particular reality or whatever. So it's completely, again, a technology-based solution that I'm talking about at the moment.
One last question. There are many people I have seen that they live in another reality afterwards this, and they cannot come back. As someone said, it does not do well to dwell on dreams and forget to live. So
you're talking about Albus Dumbledore.
Yes, ma'am.
Yeah. Yeah. Correct, absolutely. So again, we are not recommending using these technologies continuously, of course. So of course you have to get back into the physical world at some point, just like the someone in the audience just mentioned that you have to physically play games. So of course this is not a solution for as an alternative solution to your physical well-being. And yeah, I mean, this is something that we have to decide for ourselves.
He made the most out of it. Yes, that's Professor Prasad Pathak.
Hi, I'm Prasad. So being in the geoinformatics domain, I would recommend that healthcare system can also utilize mapping technology. So in the US, when I was working in ESRI, they used to have a data called as tapestry data, which used to have almost every other aspect that what our census data doesn't capture. Like what kind of habits the youths have in a particular area, what kind of medicines are being sold in a particular area. So it captures a different lifestyle aspects, I think, which will help make the decisions in the medical industry better, which also may benefit even antibiotic resistance kind of a phenomena. So geospatial technology can be integrated with this particular system. So that's a suggestion.
Yeah, that's a valid suggestion. I have known some solutions offered by ISRO where they are using geospatial technology to map contagious diseases like malaria. So wherever there is stagnant water, they're able to map stagnant water using geospatial technology at those really high resolutions. It's not put into great use as of now. Prasad is nodding there with me in agreement or in disagreement, but that sort of technology exists, but we have to put it into good use. You want to respond to that?
So it is still a remote sensing based technology, but what I'm trying to say is we do conduct a large effort to gather census data, but we should know who we are, and that should be visualized so that prescriptions can be based on very specific things. So there is a concept called as geomedicine, which allows us to explore what kind of exposures you have, what kind of lifestyle you are leading, where you are going for your job, are you traveling quite a lot. So all those kinds of things can also be captured. So it's not only what a satellite can see, what is there on the earth, but how we are living our life.
So is this a form of personalized medicine?
It can lead
It
to
can lead to-
personalized medicine. But so those kinds of things can also be explored. So it's a multidimensional mapping which can be added to it.
Yeah, thank you so much.
Good evening all. I'm Yashoran Purohit from SP College BCom. Ma'am, I have a question for you, Aishwarya ma'am. There was a point where you said that instead of the cadavers, you will be starting to use VR, AR for teaching the students, medical students especially. What exactly are the advantages for VR or AR over the normal just cadavers?
Okay. So first of all, I didn't imply that we can replace the cadavers, of course. So the advantages of these technologies is to train yourselves before actually operating on the human body. So if you already had a map of how the human body looks, where is the exact organ, what kind of veins or what kind of arteries are going to see inside, how will my drug go inside, what will happen when my drug goes in there. If you have all that kind of knowledge through the use of these immersive technologies, the way that you will practice on the cadavers and eventually as a doctor on a real human being would be much more enhanced, would be much more with a lot of skills and a lot of potential to reduce errors in that. So
As Aniruddha said, I don't have question, I have a comment. I'm not a Punekar, but having lived in Pune for 2 decades, I think I have that rightful place to make that comment as a Punekar. Right. I'm Dr. Mrunmayee Bhushan. I am chemical and biological security domain expert and a policy analyst as well. So coming from that side, when Chaitanya mentioned national security, you mentioned surveillance, innovation, Ayurveda, detection, early detection rather, AR, VR for training is like endless subject. These are all stakeholders and many more which need to be brought into one space on one platform. For this, we really need a comprehensive and integrated biosecurity policy, national biosecurity policy. I wouldn't dwell too much into biological threats, we all know, because COVID has taught us, almost everyone is aware of the kind of origins COVID may have, whether lab leak or zoonotic. Everybody knows what it is, right? So I wouldn't dwell too much into that, but considering all sorts of biological threats, as somebody mentioned that our syllabus is, school syllabus, college syllabus is devoid of any references to all sorts of biological threats. We study World War I, World War II, but we really don't study the biological aspects of it, biological threats of it. Even we don't even know about chemical warfare that was the central theme of World War I, right? Hardly anybody would know about chemical warfare, right? So these are the kind of threats that we are already facing. Geneva Convention will be 100-year-old very soon, right? So this is not something new. Why we were so afraid of COVID, one of the biggest reasons was we thought it just happened for the first time, but it's not. And this is not going to be the last pandemic also. Even WHO is telling us that we need to be prepared for this. So all these stakeholders and many more need to be brought onto one stage, one platform, and we need to have a comprehensive biosecurity policy. That's my first point. And second is, today's topic is digital health infrastructure. How about cyber biosecurity? We've always been learning about hacking of data, digital health data. But what about hacking of DNA? What about hacking of genomes? These are futuristic threats that we are looking at. And this is something that we need to incorporate in our biosecurity policy. So without dwelling too much into it, I'll just share this thought process with you. Thank you. Thank you.
Thank you very much, Manvaitai. These are some of the most prominent, recommendations that have come from the Pune brainstorming session, and I'd like to thank our esteemed panelists, our esteemed audience who has come up with such brilliant questions. They were all into it. They were all conversing. All the questions were valid, and I hope that this is not the end of this kind of conversation, and SRGF and Progressive Education Society offers numerous such platforms in the near future where we start discussing every point that was discussed. So this is just the beginning. We'll have such events in the coming times happening frequently in Pune, and let's commit ourselves to make Pune an ecosystem, an innovation hub, which is not aping anyone, which is not mimicking anyone, but it is standing on its own feet. So with that, I come to a close of this particular session with these panelists, and I now invite Varun Khandare, founder of Strategic Research and Growth Foundation, and Dr. Nivedita Igbote, who is the Deputy Secretary of Progressive Education Society, to come on board and give their closing remarks.
Thank you, Professor Giri, for a wonderful session and a very insightful session. I hope all of you, especially the audience, found this insightful. Did you? Yes, great. That was the aim of this session. And we couldn't have asked for a better flow of how this event progressed. So thank you all, especially. I'm sure you have, a number of insightful takeaways from today's session. The audience as well as the panelists, I'm sure, right? And I know I do. I'm sure Nivedita and Ali here, they have this as well. And that was the whole, that was the aim. That was what we were working towards, to get insightful recommendations and insightful takeaways from today's session, which now can be polished up and formulated into possible policy recommendations, because that's the whole idea. If we do not take all of what was discussed in this room today, everything, whether it was questions, whether it was whether we were appreciating something that we have done, whether we were talking about something extremely critical that we need to do, sitting on some very imminent issues which are like a ticking time bomb, as we have all discussed today, these need to be addressed. And that is the whole idea now, to take all of this, to put it into perspective, to put it into policy recommendations, and to take it ahead of here. That's the what we want to do is, we want to complete this loop. We don't want to take it from point A to B. It has to come back, and it has to go back into a cycle of further evolution and further introspection, if I may say so. So, having said all of this, as Professor Giri mentioned, this is the first time all of us have met on a platform like this, and I can tell you this won't be the last time. We definitely plan to host more such sessions going into the future. All of you are welcome to join in. Also, those of you who had registered with us earlier on, we have your contact details. Other than the report, the official report of this event that's going to get formulated, SRGF is going to put together a summarized report, and that will be made available to all of you. Those of you who had not registered with us, what you can do is you can visit our website. That's srgf.org. Please visit our website, drop in your contact details. There's a contact form there, and our team will make this summary report available to you within the next 1 week. So that is the whole idea. After we do this, we would like to keep this conversation, this interaction going into the future. So once again, I thank all of you. I thank the panelists, of course, Professor Giri here, and I now invite Dr. Nivedita Igbote to share her remarks about the session.
Thank you very much, Varun. I am more than delighted to be here. Thanks to Chaitanya, Varun, and Aniruddha and Prajakta. I'm also very happy that my students could be seen here and asked valid questions. That is a more pride for a teacher or a educationist like me. I was just, when I was looking at the poster here, or a flex or a design, a content design there, I was looking at the down and Vasudhaiva Kutumbakam and one earth, one family and one future. And you know, I was giving thought to it that this is not just a tagline. And if we seriously look at it, one earth, one family, one future, and seriously, like people here also mentioned that whatever our traditional wisdom says, it is seriously valid and relevant still today. Like hundreds of years before, we used to use silver spoon, and she mentioned that it has a valid scientific reason to it. Everything that the Bharat has done has had traditional wisdom to it. And Vasudhaiva Kutumbakam, again, like one of the eminent panelists here mentioned, that he is working on Nadi, and I'm sorry I was not present for your session or when you spoke about it, but I could gather some of your thoughts, and I really understood that you guys or the coming generation is so much more fortunate that we have been able to establish something known as National Education Policy, which will be implemented very soon, and it has this diverse disciplines blended together to have one concept together. So these experts have put in their lifetime to be here in their domain. Now we can have their own syllabus clubbed and have our own a degree into health and well-being. So we can have incoming future. It won't surprise me if we have BSc in health and well-being. So that can come, and I am so glad and I'm so happy that National Education Policy, and I'll be part of it. Being an educationist, though these students will pass out, but learning is a lifetime process. So you can definitely come back and do your BSc in health and well-being and all digital health or everything. Digital life has become so much part of our daily routine. Thankfully, we are eating food. Otherwise, this is getting too much into our nerves, and we are absolutely becoming slaves of technology, and that should not happen. And that is again everyone's mental strength, that we should not become slaves of it. Somebody asked question, ma'am, क्या कर सकते हैं? Reels देखना है, क्या कर सकते हैं? It is your own संयम that you should not watch it. कुछ नहीं, कोई कुछ नहीं कर सकता. She cannot do anything, I cannot do anything. I don't want to watch it, I will not watch it. That's it. That's the line we have to draw for the sustainable future of our body. That's the only thing that I wanted to share. We are very proud associate partner with this particular event. Progressive Education Society is a 90-year-old trust that runs modern schools and modern colleges. We have a stream from KG to PG to PhD. We are now marching towards an university, a cluster university. We cater, like I mentioned, we cater to bottom of pyramid, and their future lies, and that's what we think. I'm working as a deputy secretary with Progressive Education Society, and an associate professor with marketing. Thank you very much for having us. Like Professor Giri mentioned here, I want this to continue with PES and SRGF and other forums also we can join in, and then and only then people will benefit from this thought, because 100 people gathering here may not make other people aware. So making everybody aware and having these kind of intellectual conversation will be important for the sustainability of this topic also. So I feel that we should come together and we should stay together, and more people can join in, and more panelists can join in, and we can have more such sessions. PES would be more than glad and happy to host these kind of sessions in our campuses also. Thank you very much. Thank you very much, everyone. Thank you.
Thank you, Nivedita, for giving us your wonderful remarks and closing insights. So with all of this now, I'll bring this event to a close. And as I said before, please remember that this is the first time that we've all met here, but this is certainly not the last time we're meeting here. We will meet again in the future. There's a lot of topics and ideas that we've picked up on which need to be explored further. And with all of your support and involvement, we will be taking this forward. Thank you all so much. Now, we have tea and snacks for all of you. It's right here at the back. Please make your way to the back of the auditorium. Thank you.